All opposed?
And just as a point of clarification, this takes place on June 30th, 2021.
Oh, okay.
The way the cycle works.
Okay, thank you.
Thank you. All right, the motion passes unanimously 4-0. Thank you.
Thank you.
Thank you.
Thank you both for joining us tonight.
All right, our next item are the legislative priorities. Superintendent, would you like to take the lead on this?
Sure. So each year, well, this would be our third year. This would be our third year of looking at the legislative priorities of the NAMPA School Board of Trustees. This document serves as a guiding document when we individually are working with our legislators, so that we're not voicing a personal opinion, but we're actually voicing an opinion that the trustees have looked at together and in unison would agree with. And so we've outlined what those objectives are. You'll notice that this has changed a little bit to reflect the 4 areas that we have taken to ISBA as resolutions, so that we've included those. A couple of them were already previously on here. And then we've talked and anticipated what might come up in the legislative session. It's always really difficult to know this early in the year, but we have included a few other items that we anticipate might be coming. And so this is for your review and approval. And once it's approved, then these serve as talking points as we individually work with our legislators.
Thank you. Trustees, any discussion on these? As I reviewed them, they all looked to be either a previous legislative priority that we had or a resolution that we had brought to ISBA. I didn't see anything on here that was in addition to either of those.
Just the few that are represented with ISBA. So in ISBA, we added, we certainly are wanting to advocate that our teachers receive 2 steps so that they aren't penalized for that. That is a new piece of information for us. We also are looking at, well, we had 4 of them. One was full day kindergarten, which previously was a priority. So you are right, it's either our ISB resolutions or things that we have talked about previously.
Okay. That's what I'm remembering as well. And
I should also point out here for our classified folks who are listening that our board supports and does have an ISBA resolution to support increased pay for our classified personnel. That remains an issue for us as a district, and it's a pretty important part of what we'd like to advocate for.
Madam Chair, I thought these were all fine. They were, like you said, reflective of our dialogue in the past. I'm wondering if perhaps at a future meeting we could discuss, there may well be some conversation around health districts in the legislature. And at the regional meeting for the Idaho School Boards Association, I had suggested maybe a conversation about would it make sense if we had, and this is no criticism of our current health district, but us all being so close, we've had some challenges as we've made it through this, having 2 separate health districts. And maybe a conversation among trustees in the two areas. We experience it because of the 4A, 5A split and where some of our teams land. But just throughout this, it's been interesting to negotiate this time when your next door neighbors are acting a little differently. So it was just an idea. I think there was some interest for conversation around that.
I appreciate that, Trustee Westphal. And you know, my thought was similar on that, which is why I was extremely thankful that the SIC was able to come together and have some unity around that. I guess I'd be hopeful that the state board would maybe potentially do something similar to help alleviate this. But it's good conversation and thought.
So I would move that we approve the legislative priorities for the Nampa School Board of Trustees for 2021.
We actually don't have this listed tonight.
Oh.
Tonight, I'm just.
Oh, we do.
Yeah, we do.
Oh, you do? Yeah, it's off to the side. My apologies.
Oh, I double checked it too.
Yeah, it's different in two
First,
spots. I
yeah.
apologize, Trustee Westfall. Please continue.
Nope, I just put a motion out there.
Moved by Trustee Westfall, seconded by Trustee Simpson.
I do have a question.
Yeah.
I don't know if this is like, it needs to necessarily be a question but where the ISBA convention is this week and voting is gonna be taking place on Thursday. I'm wondering if there's a possibility that we might revisit or add to this possibly after that fact. Maybe after, even based on what Trustee Westfall just brought up, but if there's more conversations or something that come out of that we feel needs to go on there. I just wondered that maybe that might be something that we look at and possibly change, so.
I think that's a great idea. I think that at this point, we're only guessing what we might see in the legislative session. We are anticipating that there might be some other topics that we might need to explore together in order to add to this.
No, I appreciate that. And I think we can absolutely revisit it, add to it. I think I'm still questioning if they're gonna relook at funding formula, that kind of thing, and when that comes out. And some of that's been addressed in here from previous items, but we'll definitely just continue to keep an eye and note that. Thank you. All right, moving along.
We have to vote.
Oh, I apologize. Thank you. All in favor?
Aye.
All opposed? And that passes unanimously 4-0. And we'll look to put that on future.
Madam
board.
Chair, I need to interrupt. It's come to my attention that
I think
maybe,
we just got it.
are we good?
I think so.
Okay. YouTube's back up, or Facebook, or something.
Okay.
Something.
Something is back up. We were down for a little while and I just
You got it.
wanted to make sure we could connect people.
We're good. And next time that happens, if we'd like to take just a brief recess, we can do that. Okay. Everybody's back up and we are on new business item F for curriculum instruction and reopening survey results. This is just information purposes.
Correct. And we're gonna go through this data. We're assuming that you have looked at it, but we are gonna hit some highlights. So Mr. Jers, if you could bring up the fall parent survey results.
And we got Michaela turning loud for us. We turned it in, but
Are we good?
mm,
Dr.
No,
Schulte is joining us, and we're hoping that at 7:30, we have 3 invited guests to support the trustees with questions related to the reopening plan. So we'll give you some context here, which might influence that as well. And then hopefully we can get to our guests at 7:30. So we did have quite a few of our patrons respond, over 2,600 responses. It was sent to over 14,000 of our parents, so it represents about a 20% response rate for our district. We did separate the results and asked our NOVA parents a little bit different type of question than we asked those who were in our traditional schools. We shared with you the percentage of the responses that represent from each school. You'll notice, which is typical for us, that our higher poverty schools have lower response rates and our more affluent schools have higher rates. That's very typical in a survey, but it's always something that we want to be mindful of. We did ask some curriculum type of instructions. This does help us make adjustments based on what we're learning. The good news is about 3/4 of our students, their parents said that they are able to access the materials pretty consistently. There was less than 2% who said no, they couldn't access those materials. So that's good news. And when we find out that they can't, we're on it. And we have an amazing tech team. that follows that. In question number 2, we asked about whether or not their students were engaged during the online days. And we didn't talk about Wednesdays, we were talking about their e-learning days. The researcher highlighted the 1 to 2 hour points as the most common response. However, when we look at our students who are spending more than 3 hours a day in online, 50% of our high school students are spending more than 3 hours in their online learning. This is a parent's perspective. 42% of our middle schools and 38% of our elementary. So where there is in each case a majority of students who are spending between 1 and 2 hours, we do have pretty significant numbers that are spending time on their e-learning days, 3 or 4 hours a day. There's a strong majority of our parents who felt like the in-person days were going well for their students. We still do have some folks who responded that it wasn't going so very well. Again, an anonymous survey, it's really tough to track that down, but we are looking in aggregate for the questions that they have and looking for commonalities. We were checking for understanding on whether or not students and parents understood the opportunity on a Monday to set out the learning for the week. You can see that over a majority of parents would say that their student is aware of what's going on and what's there. We still have, depending on the grade level, about 30% of our parents who are uncertain about that. In our NOVA survey results, we have what I would consider a pretty strong majority who believe that the online environment is working for their student at the elementary and middle school. We have had some issues with choices for electives and in participating with IDLA in our high school. And we recognize that that's a challenge and we're continuing to work on that, but you can see a difference in parent satisfaction at the high school level there. We did talk about, particularly in NOVA, a parent's ability to monitor learning in our new platform, Otis. Again, our elementary are feeling really good about it. Our middle school, it's about a 50-50, and our high school parents are not enjoying it at all. Well, not at all, but you can see a clear and distinct difference. So that's an area that we can focus on. Technology, again, most of the time, sometimes some of the time, but and it does seem like we have a little more challenges at the high school than we do at the elementary and middle school. Again, expectations, we have a pretty strong showing at the elementary. We have an opportunity to get better at it at the middle school and high school. We did take this opportunity to ask parents how they like to be communicated with. We have wanted to communicate more throughout the crisis and the pandemic. It's still really hard to know how to balance and where to figure out where parents are getting their information. And you can see the responses there. We did have some responses that say, hey, way too much. Others were like, yeah, we would like, and so we'll use this information to adjust how we're communicating. And then questions related to our reopening. You can see the information that's right there. We are going to share with you some comparative pictorial representation, so I won't cover it here unless you want, well, I'll do it anyway, because we have people listening. So about 2/3 of our parents, excluding our NOVA parents, if we take that out, about 2/3 of our parents or respondents to this survey said that they would really like to consider staying hybrid if Southwest moves us to red. I just wanted to note here that in the no, the third that said no, that represents about 4,500 students that we would, if parents chose not to send them, that we would just have to figure out how we're providing education for. So that's the number that we would be looking at. Consideration for 4 days in the orange, that number goes up And the parent response was almost 72% of them said yes, they would love for us to consider that in our plan. And if we were considering 4 days in the yellow, that number goes up to almost 85% of our parents who would encourage us to consider that. The phased-in approach, 60, not quite 60% said that they would look at that. We have shared with the board, the researcher kind of combined what she did is she themed and brought those common themes to the top. For those of you online, this document can be found on our website. But there were 344 comments, which really were labeled an increase for in-person school opportunities, whether that was to stay hybrid in the red, 4 days a week or 5 days a week. So all of those ideas were kind of couched into getting more face-to-face time. 151 comments that just really encouraged us to stick to the plan that we have in place. There were another 33 who said, please stay online until you're out of the red. And then there were a group 20 who said, could you do either or and not move back and forth between that. And finally, there was a 38 statements that the researcher labeled said, listen to staff and teachers, keep NSD safe. There were some comments about schedules. We had parents who offered what the researcher labeled concerns for kids. My student is falling behind. I'm not sure that they have enough time to address what they're doing. There were 10 folks who talked about depression or isolation for their student, and 14 who expressed an opinion that felt that online was a really difficult thing for their student. There were, on the current schedule, some concerns expressed about the work on the remote day. This second concern that showed up, we tried to work on and use Otis, but we clearly have some more work to do regarding lots of platforms that parents are dealing with. This particularly escalates when a parent has more than one student that's represented across grade levels. So the platforms that are appropriate and that we are using at the elementary are different than what we're using at the middle school and the high school. And for a parent who has to juggle it, that is a difficult thing. In-person classes at the high school are too short. There were 10 folks who shared that comment, and some who asked to keep in-services on Wednesdays. I think that was actually a result of our Fridays and Mondays off and encouraging us to try to use that Wednesday time and keep Mondays and Fridays open for students in attendance.
Sorry, will you say that again?
So I think that was in response to the survey was given right at the time when we anticipated having 3 Fridays off in November for our Y group.
Yes.
And I think the comments were related to the fact that if you're going to do in-service or professional development, could you do it on Wednesdays when kids are already not in school and stay away from taking more time away on a Friday or a Monday?
Thank you.
Mask and face coverings come up. We had 30 who asked us to have no masks. We had 12 who said we must wear masks. And there was a string of comments, 5 of them, who wanted us to address recess and whether or not we wore masks. There were patrons who expressed thanks to the administration, to the school board, faculty, staff for working diligently. So those were the overall results. The board also received all the individual comments and is a document that is also sitting out here for anybody in the public to see. So questions related to those results?
Can I ask you a question?
Please.
So my question is that I came up yesterday in the town hall meeting that the parent survey was being shared outside of parents in the district and even possibly outside of the state. And so I just, that brings up concerns for me just with 20% respondents, but of that 20%, they may or may not be parents with kids in our district.
So we did have some parents who are not associated with our district, who don't live in Nampa and whose kids have no relationship with Nampa, who let us know that they were forwarded the link to the survey and were asked to complete it. So we're thankful to those people for sharing that. Trustee Simpson, there's really no way for us to go in and say, oh, that was this one or that one. And so we held all of the survey responses and didn't delete anything. We could have tried to go through IP addresses, but we easily could have had a parent who was traveling and jumped on from a Texas IP. So we didn't feel like we could eliminate. So the survey results that we have here before you include all of the responses that were valid, meaning they completed the response, and we have disaggregated that.
Okay, thank you.
Madam Chair, just a clarification. So we do not know if any of these were. We know parents said this was forwarded to me, but we don't have any, just to clarify, we do not know for certain that.
Can't
any of
tell
these-
one way or the other.
Okay. So there's a possibility that none of these were taken by outside, but there's a possibility that some were.
Correct. There's really no way of knowing.
Right.
We do know that we had parents, and we're really grateful. They said, hey, we went in and took this. We actually thought it was, and then they said, and we realized we didn't have kids in your district. So we thought we'd let you know.
Thank you.
Okay. All right. Any other questions? All right, I am actually, I'm going to skip the October 15th and go to the town hall document because it includes those results so that we don't have to go over them. And then we are, we'll do it quickly. So wanted to share with the board the information that we shared with town hall. We're hoping that you did have time to review it. It did start, go ahead to the COVID context, Peter. We did start with data from the state level, the next. Next. So we started with information, and all of this data is coming from, we share with you where we're getting the data, and this is the most recent data that we had related to what's going on in the context of Idaho overall, telling that we have the third highest positivity rate in the nation. At the time of this report, which is now a week old, 18.3%. Again, 10% is one of those numbers that should be in our head thinking, and then we have the 10th highest rate representing new cases per week in the state of the nation, in the nation. Currently, I should say on November 7th, when we went to this website, Idaho's average daily incident was 57.9 per 100,000. Southwest District takes that number and makes it per 10,000, so 5.79 per 10,000. And then we just shared some other information. Go ahead, Peter. We shared some context in Canyon County. Remembering in August, this was really the only data that we had available to us was what was happening in Canyon County. And again, their 7-day moving average was 58.2. The state rate, 57.9, so Canyon County exceeded that rate. And remembering that the benchmark for Southwest to move us to WED is 50 per 100,000. Just as a note, Ada County's benchmark to move to red is 20 per 100,000. So that's an important distinction when we have conversations later. It is important to note that the rate that we're looking at today, or on November 7th when we looked at it, that rate is twice the rate we were looking at on August 24th when we opened fully remote. On the day that we looked at this again, it looks like we checked it on November 9th. Luke's web page was showing a 15% positivity rate. Al's was showing a 21.2%. And Canyon County's positivity rate was 13.39. Next.
Superintendent, just to clarify, the 58.2, that means out of 100,000 people, 58.2 have tested positive. Is that correct?
It's, I believe, a daily rolling incident rate. So it's an average and it changes for 7 days.
Right, but that's the rolling
Yes.
average. Okay, I'm just making sure that was what the number was. I'm sorry, I
Yeah, we did visualize it as we shared with our staff. The first thought is August 24th, our first day of online, and then where we are currently on November 9th. Next. So we are really grateful to Southwest. They responded to our.
Can we go back to that slide, that previous slide? Can you tell me in there when we went to hybrid?
3 weeks after that date.
September.
I'm sorry.
21st, September 21st was the day we went to.
I'm sorry, I don't
Roughly where September 22nd is,
Right.
where it starts to climb?
Yeah.
Thanks.
And then dips and then.
Yeah. So, yeah, okay, thank you. Sorry, I don't have that date in my head. Next. Again, we're thankful to Southwest. This board asked them to give us some city-specific data. So we pulled the city-specific data. So Nampa is at 57.63. That was noted on November 6th. On August 24th for Nampa, it was 24.75. And then we looked at the number of cases that we were experiencing on a weekly basis, 195 in August, 354 the week of November 1 through 6. And then this rate right here, noting that it really is a little bit dated, but it was the most current rate on the website. But it was a date ending on October 31st. This is just a picture graph so that you again can see pictorially what's going on within our city.
Do you remember what the orange represents?
The orange are probable cases.
Probable, thank you.
All right. So then let's bring up and Trustee Westfall, I'm going to share this information that you asked. Trustees, I think you have our most current up-to-date that was published this afternoon at your places. Did we send this to Trustee Westfall?
It is in the board documents.
The newest one? Okay, perfect.
Or it was in an
So
email.
it is in the public document?
So again, this data is from the most current data that we have compiled. And then I'll share you with where we were yesterday. This is for the week of November 3 through 6. You notice that we actually still are seeing a relatively consistent percentage of students. Remember that we're taking a check when they're here physically, but we're also taking a check when they're completing assignments as they are at home on their remote days. So it's a combination of those two. You can see, and I'm going to skip that second one and go to substitute availability. We had really concerns the week of Halloween, that week right before Halloween, we slipped into our red benchmark, 73% of our cases. Really consistently, what we're experiencing is we're actually experiencing fewer requests for substitutes, but we also have a poorer fill rate. And this, although we have over 200 substitutes that are in our system that are eligible and could work for us, we consistently really only have 50, 55 who are consistently picking up work for us. So last week we did institute a different pay rate and an incentive where if they worked the full week for us, that they would receive a bonus. So if they work one day, that's great. They just got the increased rate. But if they worked all 4 days, then they got a weekly bonus. Going kind of back to the blood bank idea. You come all 4 days, then you get a bonus. And you notice that we were able to pick up a little bit. Again, this represents classrooms that we're having to cover. We're pulling classified staff, office staff. We have principals teaching PE. We've got all sorts of things going on in order to make sure that instruction continues. You notice that on November 9th, we are starting to experience the thing that we feared might close us down. We are starting to see COVID spread among our bus drivers. 2 times in the last week and a half, Brown Bus has cleared their office and everybody's been out driving routes. So we're right on the edge of having to adjust and change routes, delay routes. They've been great to us. And in both cases, we were able to work through it, but we're right on the edge of a concern that we have at getting kids to school. Our most up-to-date cases, we have 10 employees. Last week, we had 10 employees who were positive for COVID. We had 21 students who were positive for COVID. Last week, we had 12 additional employees who were quarantined because they were identified as a close contact that may or may not have been a close contact from our campus. You know, if my spouse comes down with it, I'm now a close contact, has nothing to do with my work, those type of situations. Yesterday, we had 10 employees, but we had 21 staff who were quarantined. Our student number, you can see, actually stayed pretty consistent across 2 weeks, 153 students. What we are beginning to notice, and I don't know if this is a trend, but certainly we now have only half of those students who are being quarantined because of close contacts off our campus. Remember the week before, we had 100 out of 150, so almost 2/3 of them who were quarantining because they came in close contact with somebody at a youth group or at an outside athletic event or a family gathering. But that number certainly shifted on us this last week. And too early to tell if that's a trend or a fluke. So I think what we did then, I'm just now going back to that other presentation.
Might I ask a question on this?
Uh-huh.
A question and a comment. My question is, because people are quarantining for 2-week time periods, do these numbers reflect only those who have started that week? Or are
These
these,
are any
so-
student who is absent because they're on quarantine.
okay, so for the week of October 25th through 31st, we have 13 employees out, and the next week we have 12. Those could be 12 of the same employees plus one more. Is that correct, or is that?
So yeah, let me.
So it's
give
not
you-
13 more.
Right, not necessarily, but let me give you our overall numbers. We did crunch that data today. Since August 30th, we've had 115 students who have let us know that they have tested positive for COVID. I emphasize have let us know because we only, if Southwest knows they're associated with us, we get that information. We don't know who might have gone to get tested and would be positive. The majority of those are high school students, over 54% of them, 26% of them are elementary students, and 20% at the middle school. Since that same date, August 30th, we've had 35% of our staff who have reported to us that they tested positive for COVID. What's interesting here is that 46% of them are at the elementary and not at the.
Do you have numbers for that or just percentages?
16 elementary teachers of the 35, 46% tested positive.
Sorry, I thought you said 35% of staff, so it's 35
So there's
staff.
35 total staff.
Okay.
46% of that 35 are elementary, which is
Okay.
16. That overall number, the 35, represents 2.6% of our staff. And that number of students is less than 1%. So what we do know is that what we have implemented is working well. It's working well because we've been able to physically distance. We required masks. We've got lots of sanitation and hand washing going on, consistently reminding us to keep our hands away from our faces. Our employees, our teachers have done an amazing job at following through with the plans that we have in place.
Superintendent, the slide on the screen, I think you're referencing our dashboard that you're using. The slide on the screen indicates that it looks like a lot of folks, their exposure is outside of the school district. Is that slide right? 17 of the staff were close contact for people outside of NSD?
Yes.
And then I think there was another reference, maybe it was students, there were activities outside of the school.
Right. So, and you'll look at those numbers related to last week numbers are really similar. Again, 156 students quarantined, but 106 of them were quarantined because there was close contact outside of our campus. I went to Gwen and we went through the numbers for the data that's in number 4 there. When we currently had 21 quarantined, she counted and mentioned that 17 of those staff were close contacts for people outside of the district.
Is that out of the 21 or out of the
Out of
31?
the 21 in
Not
that
the-
particular context.
Not the 31, including the staff
Right.
that are out with positive?
Correct. That 17
It's
related
just
to
related
those
to
who are
21.
quarantined.
So one comment, I think it's interesting to note that if we're looking at this graph on this paper, the last column, you were saying there's a concern that only 82 of the 153 were from close contacts. But it's interesting, if you look back at the first 2 weeks that we have on here, they also, we got, I guess what I say, we got really good during that week of the 26th through 30th, because those numbers are also, 46 out of 71, that's only half, So it's interesting to see the numbers go up and kind of drop again. Hopefully we can swing back up.
And again, we have what 13,000 students in our schools and 1,200 employees?
Yes, our number we're using is 1335 of full-time daily reporting employees.
And Superintendent, I was wondering, as we're kind of doing this, where are we now in terms of the health of the organization, our mitigation efforts, our that sacrifice of wearing a mask and washing your hands and being on a hybrid schedule is working, that the spread is coming from outside. And I was wondering, is Kimberly from the health department online?
Kimberly is online.
And
I should say that right now we have Kimberly Beckley from Southwest District Health. We have Dr. Michaela Schulte from St. Luke's, and we have Dr. Lee from St. Al's. And I noticed that we also have Mr. Childs here from St. Al's. I'm sorry. Did I miss it?
Yeah. And so just kind of as we're doing this status quo where we are right now, I didn't know if Kimberly, from that public health perspective, looking at the largest employer in Nampa, could talk about, because it sure sounds like with the cases increasing in Idaho and our town, the safest place is to be in the Nampa School District, whether you're an adult or a kid, in terms of contracting COVID.
So what we are seeing is primarily kids are getting exposed outside of the school. We aren't seeing, spread within the schools. We are having kids having to go home and sometimes staff go home on quarantine, because anyone who's been in close contact, we're going to recommend going home. But we're not seeing a lot of those students, or very, very many at all, actually show symptoms of COVID, which is great. I believe that is a testament to how hard the school is working to, wear masks and social distance as much as they can. We are definitely seeing an increase in cases, which is concerning, but we're seeing an increase in cases throughout our community. And I think as a community as a whole needs to start taking some of these measures that the schools are taking as far as, masking and limiting those social gatherings.
So would our checkup on the status quo and show that those efforts really do work?
Can you repeat that? I'm sorry.
Well, as an organization, that serves, thousands of kids, hundreds of employees, that when we do these things, this data would suggest that it works.
Correct. Yeah, it definitely is working within the schools. I do think that, it is hard to have buy-in from the community as a whole. And I think if we look at what these kids are doing and what staff are doing to be able to keep those cases down, I wish that people would use that example and do it more outside of the schools as well.
Thank you. And I know we're going to talk some more about reopening, but I am curious about folks' opinions about whether kids and adults, this really is a safe haven in a storm because of those things. And we're not talking about that now, but I wanted to plant that question.
And I need to clarify a statement that I made, which was incorrect. Trustee Keller, Ms. Coons tells me that those numbers on this data page are new each week.
Oh,
So
good.
they do not overlap.
Okay,
So
thank
my
you.
apologies. I
Nope, that's fine,
misunderstood.
that's good to know. So there could be up to 24 employees out, but it was 13 last week, 12. Okay, thank you.
I have it. Can I ask a question? So I'm just curious with Southwest District Health's data, does that include like the NNU data, or is their data completely separate? The testing that NNU is doing, is that, I just wonder, yeah, so for our folks from Southwest District Health.
You know, I'm not sure. I believe that it is separate, but I don't know that for sure.
I would guess remembering that NNU is doing surveillance testing. So they're identifying people. And then if it comes down to one of these two people are in the group that's positive, I'm guessing that that person who is now going out and seeking a valid test, because they're not licensed to test, would
So they're not
probably show
having that testing
in the-
at NNU?
Correct.
Okay.
But that's a guess.
Okay. And then I have one more question. Nope, actually, never mind. I got it and I wrote it down. Sorry, thank you.
All right, I just, we have guests that are out there. I'm happy to go through this data, but I'm also happy to wait and let the board access Dr. Lee, Dr. Schulte, Dr. Odom, Clint, Charles, I'm so sorry, or anybody else that's online. So what would your preference be? I would love for you
let's
to
go
ask
ahead
them
and
questions.
talk to our guests.
Yeah, I would love to do that.
Trustees, do you have any questions of our guest speakers this evening?
I just had, I mean, probably just general question in the overall, you know, part of this is leading up to looking at possible change to our reopen plans, and just am curious, you know, opinions on that. And that's general for all of them. Would like to hear that.
Have any of them reviewed these reopening plans or the changes that we're looking at?
They were sent to
Okay.
They do have access to them, yes.
Any of the doctors that are online, you can maybe raise your hand. Peter can unmute you. And I think the question is if you had any opinions that you could give us on the reopening plan edits that have been proposed to us this evening. Is that your question?
Yes,
Okay.
yeah, no, thank you.
Yes. I don't, do you see any raised hands, Peter?
This is Michaela Schulte. Can you hear me?
Yes.
Yes.
My apologies. I lost video connection. I live a little bit here in the countryside, just right outside Nampa. So so I can't raise my hand. I apologize. So I've been, thank you for the great discussion and the presentation of the data right now. I think that was very comprehensive, and I appreciate your very diligent approach to weigh those pros and cons and really understand that school can safely occur and keep people safe, similar to what we've seen in the hospitals, right? Wearing masks, distancing, washing hands. It does work. We have been able to keep people from acquiring infections. We know what works, and actually we're seeing very much the same in terms of our populations, that our staff acquires the infections outside in the community. So even healthcare workers are outside work, not always perfect. So just to take that into consideration. Generally speaking, I would be very supportive of children being in school, especially in a district where, we have such challenges around food insecurities, other safety concerns that are probably more prominent in this district compared to some of the other school districts that are also grappling with these decisions. I think we need to be mindful that whatever we are doing, we need to be able to follow these principles that are showing to keep people relatively safe, the distancing, the wearing masks, the hand hygiene. I know it's cumbersome. I'm pretty sure with the kids, it's not that easy to have them all the time adhere to it, but that needs to be able to be in place. I am incredibly concerned, however, that as we are seeing rising community spread will more likely also happen in the schools just by chance. It's similar to what we have seen. We've had workplace transmissions from coworker to coworker in the hospital, actually, not as much necessarily from patient to staff member, which is an interesting observation as well. I think it's obviously not the fault of the schools that we're finding ourselves in this situation, even though that we've seen this increase after schools opened. I think it's the society and our behavior in general that has been leading us down this road. Nevertheless, school is one component where people gather, and we have to be incredibly mindful of those selections. My greatest concern would be right now to become careless around those measures that have been keeping us safe. I do have a great concern looking at your plan, to be very frank here, with the athletics recommendations in the red phase. I am an avid fan of all types of athletics. I think it's incredibly important for a lot of different reasons for children to participate in that. However, in the red zone, I am incredibly concerned about especially competitive and contact sports continuing, as if when we look back and we see where spreads happen and occur, where people can't then maintain those distances wearing the masks. That is definitely a concern I wanted to share with you guys tonight. Just to really also remember that we're heading towards the holidays. The children will spend time, hopefully, with their loved ones. They will see grandma and grandpa potentially, and we are potentially heading in a further type of spread situation that could be incredibly leading to some incredible difficult situations and choices we might have to make in the next 4 weeks. So just to bear in mind that whatever we decide to do, we need to be mindful what the impact could be of children that then spend also time close with their parents. So those were my remarks. Thank you for the time.
Thank you.
Thank you.
Dr. Lee, are you on?
He was trying to speak up, so.
Okay. Peter, do you find him?
Not seeing him there. Let's see.
There you go. There we go. Allowed to talk. Okay, Dr. Lee, we think that you are able to speak now.
Okay, can you hear me now?
Yes.
Okay, thank you. I appreciate this meeting and the hard work that everybody has to do in trying to make these kind of decisions. I certainly don't envy you in your position. I just want to echo what Dr. Schulte said. I mean, she really spoke well about, I think, the concerns and the positive and the negative aspects of that. And I think one of the, I would echo her sentiment about athletics. And again, she said it very well. I won't belabor that point. I think one of the points that she also mentioned that is important is that you have these factors in place. It is being able to enforce them and make sure that they're staying, that you're staying diligent about those. I think that's probably the most important thing that we have found, again, working in these large institutions like hospitals, where you have, people are going to get sick. That's just the way it is because you have community spread. But within your own organization, making sure that you are following the guidelines, that you are maintaining distances, and that includes not just students, but in the teacher lounges, things like that. I mean, those are things that we worry the most about when adults gather, because they tend to, be a little less diligent sometimes than they probably should be. So I would just echo that part of it. I think school is very important, and we do know that right now, in looking at the numbers, it's really disheartening to see where the numbers are going, because yes, while students are going to be mostly okay, they do fairly well with this illness, parents, grandparents, they are definitely getting sick and they are definitely getting hospitalized, and people are dying from this. And that will continue over the next 4 weeks. So and that's where we see this next peak, hopefully peaking. So I would just echo what Dr. Schulte said, and I think just thank you for your time.
Thank you. Trustee Russ.
Yeah, so if I can, Clint Child, I'm Vice President of Operations, Chief Nursing Officer at St. Alphonsus here in Nampa, and just kind of echo what Dr. Lee, who I work closely with, and Dr. Schulte from St. Luke's. We have seen a lot of transmission in the community, but you mentioned, maybe the schools are the safest place because you haven't seen that. In our hospitals, we've had a number of colleagues that have come down with positive for COVID-19. As we do contact tracing, none of those have been from providing patient care. We've had a few that have been that have traced back to in the hospital, but in break rooms and in other areas where you let your guard down. So like Michaela said, where we've got more structured ways to keep ourselves safe, as long as you follow those and do not get lax with those, we can do things like go back to school. And I do have to echo the sports is a huge loss. However, you cannot practice what's needed to be practiced when you're doing close contact with any of these sports. So thank you.
Can I ask another question? Yeah. To any and all that are wanting to answer. So it's around hearing about in hospitals, here's what you're seeing. And you may not have this information, but how much time does, say, a nurse or a doctor spend with a patient that probably is positive with COVID throughout that day compared to like a teacher or a para or a principal who's in a classroom in a setting with kids all day long?
And I can speak to that, and I'm sure Dr. Lee and Dr. Schulte can chime in too. It depends on the setting, and many of the people that are coming into the hospital, we don't know if they're positive or not. That's part of why they're coming in. For those that we do know, nurses and doctors and technicians and dietary staff are spending quite a bit of time with them. The criteria is, a cumulative 15 minutes together. But as long as those precautions are taken, that is, the risk is really diminished. So it is quite a bit of time during the day.
Thank you.
And I would say that we have the benefit of mostly knowing, right? When someone comes to the hospital, we test them. We now have testing, which is incredible. We can test people. We know whether or not they have COVID. And we take precautions on a level above what you're going to be taking at the school. We wear N95s, we wear face shields over theirs, we wear gowns. So we have a level of protection that you will not have at the schools. One of the problems is you don't know who walks in the school, whether or not they're positive. We assume everybody's positive, and so we treat them that way. That's not, the setting that you're in is not the same environment, so it's going to be different. Kids go to school sick all the time. I know, I have kids, and you're not going to be able to discern which kids are walking around with COVID and which are not. So it's a little bit more, and in some ways it's a more risky situation because we are able to test, we take extra precautions. And yes, I have to wear a mask, an N95 mask for, 8 to 12 hours at a time, which you could not probably do and teach. And certainly kids couldn't do that, but that has allowed us to stay safe. So it's a little bit different, I think, in your own environment. You don't have to be maybe as physically close, which I think is one of the saving graces, as long as you maintain that spacing, but you won't have the same level of protection or knowledge about who is really sick, who's walking around with the illness.
Thank you. Trustees, any questions? Oh, sorry.
I'm going to see if I could add the one area or the areas that we've really seen spread in schools across our health district have been sports, primarily special education classrooms. So those classrooms that the social distancing may not be able to be maintained or that masks are not able to be worn, and also between teachers. So I think echoing what others have said, those times when you're in the break room and I think this has been a really tough year, and a lot of people need that close connection that they probably would be able to get normally. So the break room becomes one of those danger zones that we've seen. I think the only other area that we've seen is within lunch staff. And I think sometimes that hustle and bustle of getting lunch together in a smaller environment also has led to that as well.
Thank you.
I have a question, maybe Dr. Child, you could help answer this one as far as, I'm just out of curiosity, because I didn't see any of this in our statistics as far as city goes. Do you know the number of, as far as hospitalizations go, are we looking at the generally older population, or has this spread down? You're seeing younger and younger people in the hospital? Is it throughout, or?
No, good question. We're seeing kind of a gamut. I mean, the majority are older with some other comorbidities, but that's not all of them. We do have younger ones in their 30s and 40s that are being admitted.
And with those, are there also comorbidities, or is it?
Not all of them. Dr. Lee, who works in our ER, can probably speak a little more of what's he's seeing as far as what's being admitted.
Yeah, I think that's correct. It is mostly older people with comorbidities, and those tend to be the ones that do poorly. Some of the younger people we see that we're having to admit, usually we can get them out within a few days of supporting them. So I think that is an accurate description, that most of the people that we're having to admit, most of those people that are getting very sick are the older with comorbidities. But just like any other illness, you will have those young people who don't have any good reason why they're sick, and they get extremely sick, and some of them do die. But yes, I think that's a general statement is true.
So when we look at numbers,
Yeah,
when we look at numbers,
so yeah,
now 15%, more of that will be older generation, because that's, when it says 15% of, I'm sorry, I don't have it in front of me, of beds are full in St. Al's, and 10%.
The numbers you have up there are related to the percent positivity.
Right, but in a previous document we looked at, it listed hospitalizations. So anyway, I'm just trying to get a feel for this different community. Most of the people in hospitals, sounds like, are older, not 70 and older.
So I want to make sure that we're careful with belabeling how old people are, because I have found that a lot of my 60 and 70-year-old patients will take a lot of offense. They feel very young, and some might carry, a diagnosis of diabetes or hypertension, but are still working and are very active and productive members of this society. So I think I want to be careful how we label that. We have certainly seen ups and downs throughout this course of illness with different age groups. We have had people in their 30s do incredibly poorly and die. And I recently had a gentleman in his 80s with multiple medical problems who very fortunately went home with some oxygen and in good spirits, still not able to smell anything. So I think we're seeing various degrees. The tendency is obviously there that younger people don't have to be hospitalized many times for very long, because we now have support modalities in the home that require some ability to access internet and have sort of daily remote check-ins, get some oxygen, etc., that some of our older citizens don't have. But I would like to caution everybody when we start discussing lives. I would say that while age certainly means that you have already lived some years of life, I think we can very quickly leave the impression that we might weigh the importance of somebody's life versus somebody else's. These are sometimes grandparents that are primary caring for children, for example, because there's no parent in the picture, etc. And these are very important members of our society. So let's be mindful of that.
And I would just agree with Dr. Schulte that it is risky to say that it's only the older population that's at risk, because everybody's at risk, and we are seeing very bad outcomes with younger people and some very good outcomes with older people, and kind of a wide gamut between that. So everybody's at risk.
Madam Chair, and for anyone who wants to chime in, what public health measures could be done, here at school, we're open, we are following the advice of folks, and we are not seeing that same level of spread that we're seeing in our community. What else could we do to advocate in our community? Is it close bars, or I don't know, that we could engage our community around that would help?
So I can take this. This is Dr. Schultz again. So my recommendation would be, you guys have an amazing connection through the children. You have you're one of the largest organizations here in this county. I think just having honest conversations and sharing the experience of what is working. My concern is that people are not aware that it is actually family gatherings or multiple household gatherings that are the primary opportunity for spread. And like you said, I forgot who exactly said it earlier, I'm sorry. We're all starved for social connection, right? We moved to being very clear on calling it physical distancing, because social distancing is important. That's who we are as human beings. But to still remind each other, this is what works. One thing that struck me so much when I first moved to Idaho is like, people care about each other here. We care for each other, and that is such a great value. You know your neighbors. You stop on, when you go on a hike and talk to strangers, and somehow I think got lost, that caring aspect. Let's talk to each other. Let's remind each other and be kind, with where we're coming from. So I would say advocate in terms of sharing your experiences that these measures do work. Praise those that are really willing to follow and speak up, and just sort of move forward with our culture of caring and what makes us such an exceptional community.
Yeah, I would echo that to say that you do have quite an opportunity, because there can be specific things like, advocating for closing bars and things like that. But really, I think within the role of the school is to use the students as an example for their own, for their parents and the other people that they come in contact. If the students, and I know, my kids are, my son, he wears his mask like all the time. Like when we're at home sometimes, I'm like, Jack, you don't need to do that. But, they understand, it seems like they understand better, and they don't take any kind of offense to this or anything. They're just, this is what they say we're supposed to do. And so them setting the example, I think, is a good example for the rest of the community, and showing that how we can keep schools open without having a lot of spread, because we're doing these things. I think it's more of that connection you have to the parents, which again is a huge network within this community, from children to the parents, and then their extended families. And then secondly, sort of maybe advocating that when you have breaks, that we try to say, hey, reminder that in order to keep the schools open, in order to keep everyone safe, it's recommended that CDC says no more than 3 families at a gathering, and we would encourage you to maintain CDC guidelines. Not necessarily saying this is from the school, but just reinforcing those guidelines that are already out there. I think that would be very helpful.
Thank you.
Maybe we can continue with the survey conversation, and as the trustees have questions, they can feel free to chime in. And
Sure,
Douglas, I think we've got, if you could hang with us for just a little bit longer, we sure would appreciate it.
Thank you. We'll go through this data rather quickly. Mr. Jers, could you, thank you. Just wanted to review the 3 pieces of data that we're comparing in this next set. One is an October 15th staff survey. We had over 1,100 of our staff, both classified and certified, who participated in this survey. The questions that we asked related to reopening were really on a Likert scale that said, how comfortable are you? Are you very uncomfortable, sort of uncomfortable, neutral, etc. So it was a 5-point Likert scale. So we did ask those questions again on November 7th to parallel the questions we asked parents, which really were a yes/no question. Would you like us to consider reworking our reopening plan if next. So wanted to share why there are 3 surveys and the distinctions between them. Because there was a neutral middle ground in the Likert scale, not all of the percentages on the October 15th will add up to 100 because we took out the people who were neutral because we didn't know which way they were money. But we certainly combined those saying yes, who said they were comfortable or somewhat comfortable, those saying no were somewhat uncomfortable or very uncomfortable. Does that make sense? So Mr. Jers, next slide. Sorry. All right. Can you go ahead and, what's important about this slide, and the board has seen this slide, it was sent out in a Friday letter, just to look at the distinguishing differences between the type of staff that we serve, realizing that our middle school and high schools were more uncomfortable about considering staying hybrid in the red. This is likely because their class sizes are much larger than our elementary, but you can see there, you can also see that our elementary, I think that number is 40%, we're still fairly uncomfortable, very uncomfortable or fairly uncomfortable with staying hybrid in the red. Next one. We asked the same question about yellow. Again, you can see here, considering if we ever hit yellow, again, this was an October conversation, right? We were in the orange and we were hoping that we might be moving that way. You can see again, our middle school and our high school are more uncomfortable bringing all kids back. And that's simply because we would have to remove that first source of protection, which is physical distancing. We cannot physically distance 36 kids in a class or even 24 kids in a class. You would have to move to some type of pod or clustering, which is not as strong a technique in protecting. So it makes sense how this turns out. Next slide.
And maybe we can pause for just 1 second.
Sure. Mandy has seen all of this. She joined. Oh, she's back. Sir, are you okay?
I'm okay.
Perfect. So we did disaggregate this by level, looking to see if there were nuances and difference. So the first chart here is support for staying hybrid in the red from our elementary. The first set of bars represents our parents. 70% of our elementary parents said that they would support the district in considering staying hybrid in the red. You can see our elementary staff, 57% were supportive in October, and last week only 51% of our elementary staff were in support of considering staying hybrid in the red. In our middle school, you can see that 69% of our parents were supportive of hybrid in the red. 39% of our middle school staff, are you reading with me? I'm looking, I think, yes, okay. And that went up a little bit in the survey last week, 44%. Okay. This actually, if we go back there, this is the part that I tried to make. If the board would ask us to stay hybrid in the red, that's 30%, the 30% there in the elementary, the 31%. Again, across our district, it would mean that there could be as many as 4,500 students that might not feel comfortable returning, and we would have to be thoughtful about how we would provide education. The next graph is our high school. A little less of our parents, but still right around that 2/3, 70% benchmark, said that they would support the district in considering hybrid. 43% moving to 44%, probably not a statistically different number of our high school staff would support it. Okay. We did want to look and compare parents across. So this is the same data that you've just seen, but it compares parents to parents, elementary parents, middle school parents, and then high school parents. And so you can see why that graph turned green instead of blue, I don't know. But you can see right around 70% of our parents would give us support in considering that. Here is our staff. And you can see where our staff is at. Again, the most current first data, all of our staff combined, classified, certified, Likert scale. Second one, certified staff last week, as we talked about some curriculum information. It's right at 50% at our elementary, 56% of our middle school would not support us in that. And such a tiny number, 56% at our high school. The next question that we asked, and we did not ask this on the survey in October because it wasn't in our minds. We were thinking we were heading towards yellow. And the data here is really quite dichotomous. So considering bringing all students back for 4 days while we're in the orange, 76% of our parents at the elementary said that they would support the district, and that 73% of our staff said no, they would not like us to consider that. At the middle school, really similar percent, 74%, 3/4 of our parents, but about 3/4 of our staff were concerned about that opportunity. A little less dramatic, but still there, 2/3 of our parents at the high school would support us in considering it. 70% of our high school staff are not very excited about it. All right, next one. Again, what we're doing here is we're comparing the two groups across each other. So you've seen this data again, but it's just structured a little bit differently. Anywhere between 67%, 76% of our parents would really like us to consider 4 days in the orange, and really similar to that percentage of staff who would not encourage us to consider that. Remembering again that my guess is the most strong feeling associated with it is we are not able to implement the science completely. Right now we're successful because we can physically distance kids. We can manage that. You bring back all of our students and we give up that very first frontline mitigation strategy. Support for the yellow. Although I certainly wouldn't say we're in agreement, this is a place that we're more similar, or maybe, I don't know, maybe we're not. But in the yellow, 87% of our parents at the elementary, 86% at the middle school would certainly encourage us to consider this. And then our staff is pretty much split. You can see at the middle school, we had fewer in support of it on October 15th, but a larger group at the middle school who might be supportive of it as of last week, bringing that to kind of a 50-50. At our high school, similar, as we're thinking about yellow, and it's notable here also that as we have looked at what other districts have done, there is a piece of evidence here, particularly at the elementary, that we didn't have in August, as we've walked campuses at 2 districts that kind of look like us and that are kind of in the area with us. There is some indication that elementary students, bringing them back has worked fairly successfully. We don't yet have evidence that honestly at the secondary, middle school or high school. In fact, the places that we've looked, and I won't name those districts, are experiencing pretty out of control spread on their campuses. So that's a piece of information that we didn't have in August, that we have districts in the area who have brought back some elementary 4 days a week and are being relatively successful. They happen to be in a neighboring county whose red is more like our yellow, and so would parallel this idea. Here's the parent again, just the summary. You can see how strong the support is in yellow to bring kids back 4 days a week. And then in the next slide, you can see the comparison across elementary, middle school, and high school from our staff perspective. Really the most current one of our certified staff, right, 50-50, 47-53, right in that area. So that is the data that we have brought from those multiple surveys together so that we could look at, I am really sorry to say that there's not a really easy pathway forward and that there aren't strong lines of unity. As a result of some of this data and at the request of the board, Mr. George, next slide, we did kind of give you some ideas here. I think in presenting this data, I would first bring your attention to the last two columns where we talk about the Ada County benchmark and the Canyon County benchmark. It's really notable that when Ada County went red quite a while before we did, they went red when they hit the benchmark of 20 cases in a rolling 7-day period per 100,000. That was their benchmark for red. And you remember when they went red, they said, oh, well, this is low level red. And they now have kind of added that higher level red. And I think the numbers I looked at on Sunday were somewhere around 48, 48.5 in that range. Notice that if Canyon County was at 20 cases per 100,000, we would actually be in the yellow category. So we have quite a lot of discrepancy across a county line with two different health districts. If and when Southwest District goes red and says Napa's in the red or Canyon's in the red, our benchmark is 50 over 100,000, which is more than twice Ada County's benchmark. So we found that data interesting. We have prepared for you, of course, the original plan, reminding, I think Mr. Main did a great job telling you how it was constructed and where it started. Version 1, really the only thing that is added there is in the yellow, and it's a consideration of bringing back elementary students full-time if we're in yellow, secondary remaining hybrid. That piece right there is directed by the evidence that we saw on two campuses, two elementary campuses that we actually physically walked and found that they were being generally successful at keeping kids and staff healthy. Version 2, and just as a reminder, the board asked us to review these in light of the state board's adjustment in their plan and as a result of Governor Little's category or stage 3, where he encouraged us to stay open. Version 2 and 3 in the red suggests that the district could remain open in hybrid, but that remote was still a possibility depending on spread. Some of this is based on our fact to have substitutes available or healthy staff or that type of stuff. Maybe our hospitals are at capacity. It's really difficult to know how all of the indicators work together. In version 1 and 2 with the orange, we really are talking about bringing about targeted groups of students for intervention. We have added the words potting or clustering students. Again, not the best way to physically distance, but better than no physical distancing. In version 3 in the orange, it looks like it's similar. Secondary and hybrid, but consider, I'm sorry, bringing elementary students back full time. And then you can look at the differences in yellow where in both version 2 and 3 that we would consider bringing back elementary and secondary students full time. And then in green, all students back. The recommendations that the administration are bringing to you for your discussion now are really based on what we thought we heard your conversation around. And so I guess that's the topic right now and that you get to discuss.
Madam Chair.
Yes.
I want to recognize that our guest likely would like to depart from the medical community. I was wondering if we could maybe address any questions we have there and allow them to get back to their lives.
Absolutely. Trustees, do you have any parting questions or things with the final plan here that you'd like to ask?
My question just for any and all or whoever wants to answer, but with these different versions and the comparison of them, are there ones that you think are safe or might be safe and ones that you are like, we don't recommend it at all?
So I guess if you can hear me, I'll just start. I think it's we put these into a category. It's really hard to say one thing or the other, but I will say this, that I think it's, because really what I think we're asking is mostly about red, because that's our probably most likely scenario, probably not going into yellow anytime soon. So it seems like the versions within red are fairly similar. The hybrid with remote is a possibility. I think that gives you some flexibility. I think that is, in my mind, that still seems to be, it all depends on what that means by safe. Can you really keep that physical distancing? Is that going to happen? Because, we will see maximum capacity at our hospitals here at any time. And so that is going to happen sometime soon. But from the school standpoint, you have to be able to maintain those. If you're going to have any type of school, it has to be able to maintain those distancing. If you can't do that, then you can't, I don't think, have schools safely. So I think that's when you get to that red part, that is probably the most important thing. And that includes, how are we getting these students through the hallways and things like that. And I know that's different for every school because they have different setups, but that has to be part of the discussion. And so in the red version, it looks like hybrid is still an option, which I think if you're maintaining that distance, I mean, there's no safe, right? Safe is being at home. That's the safest thing for the disease transmission. Again, that's not maybe always the safest thing for the student. There's other considerations, but you have to be able to maintain those. In the hybrid model, you have to be able to maintain those distances.
Yeah, I would echo what Dr. Lee just said. One of my greatest concerns was that none of the plans was really distinguishing athletics very dramatically in the red zone. I do have some great concerns about ongoing competition and contact athletics. I think if you would want to look to some recommendations, the recent recommendation that came across in Utah might be something to consider, where sports are only going to be allowed with appropriate testing, which unfortunately we do not yet have on all levels. And once that would be available, that might be a different scenario. So I would echo the fact that as long as you can safely maintain distancing, as you have pointed out, the schools are probably a safer place under certain circumstances, but that is a requirement. I think one other consideration is to potentially, if you needed the space to scale back on some of the older students compared to the younger, the elementary school kids that don't seem to have quite the same level of transmission. But I did not really think any of the plans had athletics addressed in a way that I would personally feel comfortable with it.
I don't have anything to add. I think they both said it very well.
Thank you.
I have one last question. This has all definitely been geared towards the conversation of medical and COVID related, but as has been hinted on, there's multiple things that we have to take into consideration. We as a board historically have had presentations to us about the other consequences of being at home and the mental illness portion of it. Are you seeing higher cases coming into your ERs and whatnot of suicidality and things of that nature that we should also be concerned about?
I think I can speak to that. I would say the answer is, this is more from my own personal experience. Again, I don't have numbers in front of me, but I would say the answer is probably yes. I think there are, in our younger population, the number of patients that we're seeing, that we're placing into mental hospitals, things like that, seems to be on an uptick. And that creates its own, that's obviously its own concern all by itself. So yes, I think that is obviously it's not a large number, but when you compare it to, I've been working in the emergency department for about 15 years. It seems to be just in a general sense that we have more of this, but I don't think I have those numbers in front of me that I could say with a great deal of certainty. But yeah, it is still a concern.
Thank you.
This is Dr. Schulte. I just wanted to also echo that many of the stresses that we are seeing are obviously also going beyond school. School is obviously an important aspect of that. And just really, really appreciate your thoughtfulness, this great discussion that you're trying to really understand this subject matter and how much you might be able to be also an advocate for us as a society to move together and tackle this together. I think a lot of the anxiety, stresses, etc., that are happening are COVID related in the greater scheme of how everybody is stressed for the impact, not just the health impact of it. And in that regard, I really appreciate that you guys are asking great questions and are making these difficult decisions to the best of your ability.
Thank you. Appreciate your time tonight and for being with us and for all your insight and help this evening. Thank you.
Thank you.
Thank you.
Why don't we go ahead and take a 5-minute break and we can come back and move to our next action item on the agenda. Sound good?
So, just talk, I call these COVID adjacent problems, like all the other problems that just the stresses
Right.
around it. Clearly teaching geometry right now, COVID adjacent, but, I wondered, Superintendent Keller, if you could, I didn't ask this ahead of time, so I know you may not have the numbers, but, Eric Main, the NAPA EA president, brought up, employees utilizing assistance more in this year, and I wondered if we had any sort of indicator of our employee assistance program. And then in conjunction with that question, I know the district has taken care to put folks in buildings to help kids with social, emotional problems within this year. And so I just thought this might be a good time for maybe an update on those things and if we have trends or things that are happening there and what's going on.
Yeah, I'm going to ask Shelley Bonds if she's on there, and perhaps Gwen Hamlin, so that we get actual accurate information. I can talk generally about it. Shelley, did you hear the question?
I sure did. So, Trustee Simpson, what we have going on so far, we do have our EAP program that Gwen can speak more eloquently about. One of the other things that we've done is been working with one of our amazing community partners, who is Janelle Stoffer. She's been working with me to help get some on-site community-based mental health supports for teachers. And that's slow because there just are not enough providers. However, we have it started on one of our middle school campuses, the second middle school campus coming shortly, and then we have it on the option through the YCAP launch grant at 5 of our elementaries as well for K-3 teachers, and then we're working on funding for the 4-5. So we do have, in addition to the EAP services, we are working for folks, we're doing surveys, and then we have had some other buildings who have surveyed folks that we're working to try to get providers on site, but like I said, it's just a slower process. And also to meet the need that's being requested. We don't want to put something out there that then we can't fulfill. So we've been going at it, trying to be very purposeful about how we do it. The other thing that we have done in the past, and we recently talked with a leader about this, is we can also have ComPsych, who is our EAP provider, come in and run groups, as well as some of our community-based mental health providers can also run groups. So some of the survey questions we've asked are, would you prefer to be seen as an individual, or would you prefer to be in a group, which we know that social connection is important. Some people have said group, some people have said individual, some people have said both. So we are working very hard, and I'll let Gwen talk about the EAP program through ComPsych.
Shelley, before she does that, would you just remind us what we're doing for students on our campuses?
You betcha. So we have partnerships with Tidwell, which has greatly expanded this year. We have partnerships with Life and Terry Riley and Pathways at many of our sites. And so those kids are able to be seen every fall. We have to start back over with paperwork. And so some of those kids are coming in even on a Wednesday to be seen at some of our sites. And so, yeah, we've got those services that we've had in the past. We're moving. It always takes time in the fall to get everything up and going again, just because of the regulations for how they bill. But we do have those services up and going.
May I ask a question? Mrs. Bonds, can you explain to me what those services mean? Just, you use some names, but I don't necessarily know what all kind of services that helps.
So all of those names, Tidwell, Pathways, Terry Riley, all provide counseling services on campus for students who are referred or whose parents are interested if there's space. Sometimes we are full and we have a wait list. So it's the same thing when we're bringing in counselors from the community to come in and be on our campus for teachers. It's anonymous. We don't know who's being seen. They have an opportunity to sign up anonymously and actually see a counselor during their prep. One of the things we know is a barrier in talking to teachers is having to leave campus. most counselors have very few appointments in the evenings and really hardly any on the weekends. And so we know that leaving campus is a really hard thing. People don't want to leave their kids or they can't. And so finding ways to help get them the needs met has been one of the things we've been working on. It's still not up to scale where we would love to have it in every single building, but we're certainly working on it.
Awesome. Thank you so much.
Yep.
Gwen, are you online?
Yes, I am here. Can you hear me?
Yes.
Okay. So within our EAP program, which is run through ComPsych, we do have hours available where they will go out to sites where they will do group sessions with our staff. And also too, I have reached out to them to verify like what is the time frame when someone calls in to try to schedule with the counselor. And so what happens is they will call in and they should get a return call within 48 hours of scheduling some time with the counselor. Be sure that those individuals that call in and get that call back should be getting an appointment within 3 days of that call in. So they have reassured us that they are working really hard to make sure that they are getting that service out to our employees that need it through our EAP program.
And again, can you tell me what EAP stands for?
Sure, it's an employee assistance program.
Thank you.
Gwen, I know we don't want names and we don't have names, but do you have like numbers to know, is that increased from previous years?
No, I don't have that report yet. I do get that report, and I think it's first part of December. I should be getting a new one, so I should be able to give an update here soon. But they do send me reports out. I think it's on a quarterly basis. So I should be, and I can request it also. So I'll get that information for you.
Thank you, Gwen.
And just to clarify for anybody listening, we don't get names, we just get numbers. I wanted to clarify that.
Thank you.
Superintendent, I think during the break, we were able to receive some information that we probably need to kind of share with folks at this point. Typically, Southwest District Health updates their numbers the end of the day on Wednesday. It seems that they have been able to do so confidently a day early. And we, as of right now, have been placed in the red category for Canyon County. So with that and with the reopening plans that you have offered us, did I hear correctly that you would like us to that you're recommending version 1, or would you like to go through that?
Yeah, so let me offer a recommendation. I want to start with the context of what's been a really busy, heavy day. And I'm sure just the same for you as well, as you considered all of the information that we have. I had the privilege of walking some buildings today. I got to see our teachers doing amazing things. So hybrid is not the easiest thing to pull off, but there were teachers in their classroom. I saw a math lesson where kids had studied before and now they were doing their homework while they were under the guidance of a teacher and they were getting support and help. So one teacher working in the classroom, but also chatting with the kids that were at home. So kind of multitasking. I saw a group of kids who were actually planning a group presentation together. Some of them who were physically with us and the other part were on their off days and they were working together through teams doing those types of things. So I know that we are not doing face-to-face everyday education, but what we are doing has some incredible, amazing aspects to it. Our teachers are working, as Mr. Main mentioned, as hard as they've ever worked, doing really important work. I got to talk with some parents today. One parent was going home during their lunch break so that they could check on the work that their student was doing. So we recognize that where we are right now is difficult for parents. One parent shared with me about their teenage daughter, and then all of a sudden said, oh, that probably would be happening with or without COVID, and going through some of those things. We've had the opportunity to talk with lots of parents talking about close contacts and positive cases. We shared data tonight that 50% of our high school students were working more than 3 hours a day on their off. And so I really want, when we're having this conversation, to be careful of, we're not open or closed, we are open. We are open, and we may look different than what we did last time this year, but we are open, and our teachers are moving students forward. We shared some issues with you tonight related to numbers. We have talked about our sub issues. We've talked about our bus driver issues. Our doctors and Kimberly from Southwest did a great job talking to us about community spread, how we're doing some good things on our campus. We shared other pieces of information. A third of our parapros are 55 years and older, 33%. 15% of our teaching staff are 55 and older. Our teachers are working every day, talking and working with the students that are sitting before them. They're working with students that are home on their off days, and they're now starting to work with, in this week, 150 students who are newly quarantined and are not able to come to campus. And they're working through there. You and I both are getting in conversations and emails and phone calls from community, from parents, from staff. We have to consider the balance as an employer and the role that we have to educate kids. And part of that role is to make sure that we do have healthy staff. I've been asked more than once in the last couple of weeks talking about, why can we not just fully open like McDonald's or like Walmart? Why can we not do that? And I think there are some, there are still some states that haven't opened since March. Their states have said they're online and they're still online. We have a lot of businesses in our areas who have gone fully remote. My insurance agent has gone fully remote. We meet and we do that. There are some that actually get to control who comes into their doors. So BioLife, they make you line up on the outside, they tell you which dot to stand on, and they're able to control that. There are some businesses that get to mandate masks and not. And you can say, if you're going to come in and shop with me, Costco is an example, then you need to wear a mask. We actually have done all of those things that those businesses have. We've gone remote, we've changed our delivery. We have managed the distances within our building, and we've set up restrictions and number of kids coming through our building and limited the visitors that are in there. And we have talked about PPE and what you need to wear. So we have done many of the same things that our businesses in the community have done. The difference for us is that we have teachers in a 35 by 35 foot classroom who 8 hours a day are together with students who come from a variety of backgrounds, and they get to stay there. And they, regardless of our implementation procedures, have the ability to be exposed at greater levels. When I get to go to Walmart, I get to choose which lane I go down. I get to choose that. I can choose to even not go to Walmart in order to make that happen. Our teachers, when they choose to come to work, realize that they're called to serve students. There's not one who wouldn't prefer to have all of their kids in class with them. The caveat is when it's safe, when we know that it can be safe. So we've offered you options. Honestly, in all of the information that we have looked at since March, there's only one piece of information that would drive me to think about not sticking with our original plan. And that's the tours that I've taken on 2 elementary campuses that look like us and realize that those teachers and those students seem to be surviving pretty well. I know in both cases, their boards are considering going back online or going back to hybrid because of what's happening in our community. So my recommendation, based on the fact that we involved parents and our staff, we presented this plan to our staff signed contracts based on this. If you feel like you can't stick with our original plan, I would recognize and support version 1, where we would go remote if we go red, that we would be hybrid in the orange, and we've been doing that. We're just about ready to hit our rhythm. And then in yellow, and the words are purposeful there, is to consider bringing back elementary students full time. We've started conversations with first grade and kindergarten teachers. In many cases, we would be fine bringing them back. There are a handful of places that we're going to have to be creative, because there's no way we'll socially distance 26 kindergarten students at Reagan Elementary. We're going to have to be creative. But we'd like permission, if we ever get to yellow, to explore that and find solutions and abilities with that. So as we've talked about it, and we've run the gamut, because there's a lot of things to consider here. We would suggest, if you, again, don't want to stay with the original plan, consider version 1.
Thank you.
Madam Chair, for a motion,
Yes.
I move we update our reopening plan to include our current hybrid model when the alert level is red. This reflects the guidance from the state to provide options to school districts, and that the district remain in that model until Thanksgiving break, which I think aligns with the lead way that the district likes to have when things change. And that the superintendent convene a stay open committee made up of equal parts parents and classroom teachers to identify the metrics that will be used in the red to determine whether it is a hybrid or remote, and bring back a recommendation to this board.
I'll second that. So we have a motion made by Trustee Westfall, seconded. Discussion?
You need to repeat the motion for the clerk.
No, timing to bring back a recommendation. It wasn't included in the motion.
The timing to bring back the recommendation from the committee.
When is our next meeting?
Next week.
Next Tuesday.
The regular business meeting is December 8th.
Yeah, I'm happy to meet the last week of November or another time that coming week.
Is it not? Okay. I guess I would be happy to have that committee recommendation by the December 8th business meeting, when we could look at things again as well. Any thought that you're having, Allison, to that week prior to the meeting?
When do kids come back?
November 30th.
Okay, November 30th.
So we would need a recommendation, or the superintendent would, to bring back to us about whether we should continue in the hybrid. What metrics did they come up with to guide that decision? What we heard tonight overwhelmingly from the panel was what we're doing is working, and we're in the red now. Our neighbors in Ada County, while the benchmark is 20, they're at 50. So the state added that option for a hybrid. I made an assumption that, it would turn red and we wouldn't immediately switch to remote based on feedback the superintendent has given us that they need a lead in. We kind of have that lead in hitting Thanksgiving, so we can continue in the hybrid. Folks could still prep and have their devices, but we could ask our classroom teachers and our parents to dig into what we've been seeing, our successes, and what triggers might we have.
I appreciate that. I think I appreciate your motion, mostly because
to deploy one of those models or not.
yeah, I didn't, as I was reviewing this board packet prior to this meeting, I didn't see how we could potentially make a decision tonight, given the material that clearly showed parents on one side and teachers on another. It just felt like a lose-lose, no matter what we said. And I really need to understand the why behind those answers. I need to understand why parents are needing to be face-to-face. What is it that they aren't getting that's asking for that? I need to understand the why teachers are uncomfortable. Is it what are they not getting that is causing that, or what are they concerned for in the movement that we need to take into consideration? And I don't feel that I know that. I don't feel that I have a good understanding of why our teachers and our parents are so divided right now. And I would truly like to see them become unified and come up with some understanding that we can address and move forward with. So I like the opportunity that you've presented for a committee to look into those specifics so that we can address them in a plan going forward.
Is Maren?
Maren should be online, yes.
Is on. Maren, my question is for you, for our employees, because if we change this plan contractually, what does that mean for folks? Because they did sign a contract where we had if it's changed, we're deviating from that original plan.
Yeah, good evening, trustees. I spent some time on the phone with Gwen Hamlin yesterday, just talking about from a practical standpoint what the district does when an employee does essentially need to get out of their contract mid-year. I think that there are going to be a lot of issues that have never been addressed before. So I can't tell you exactly what that's going to look like. I spent some time reviewing the renewable teacher contract plus the master contract, which is currently outdated. And Idaho code as well has some statutory language regarding contracts for teachers. Nothing requires the district to enforce some sort of penalty if that contract is broken. There are some reporting requirements that the district has, but essentially the district can choose to work on a case-by-case basis with each employee and it sounds like when I spoke with Gwen, it sounds like they already do that. They already have a process in place where, if teachers have some sort of concern or aren't able to follow a contract as it was written or as they understood it would be when they signed it, the district has a procedure to meet with those individuals, discuss leave options, and then see if they can assist the teacher before they either, resign, have to take a leave of absence, any of those options. So there's no real high legal risk in terms of saying that it's now going to be, a little bit different than what teachers originally thought that it might be. The one thing that I would say is, well, crystal clear in the sense that at least there's a bright line rule, but of course the law is never crystal clear. I would just keep in mind that statute that we talked about early on in the year that was passed for school immunity. And that was Idaho Code Section 63403. And that does require that all school board actions taken will only receive immunity if they are reasonable, and that the school board will see some sort of legal liability and risks. And this would apply to the contracts as well, if those decisions are, and it says willful or reckless. Willful and reckless is defined in statute, and I think I put the language here near me. Let me see here. Willful or reckless means conduct in which a person makes a conscious choice as to the person's course of conduct under circumstances in which the person knows or should know that such conduct both creates an unreasonable risk of harm and involves a high probability that that harm will actually result. So that's kind of the standard of care that the board needs to consider as they're looking at both the reopening plan for students and then also asking employees to, you know, show up for work every day or honor those contracts and things like that. But I will say that in talking with Gwen, I'm very comfortable that the district already has in place a really good process to review those contracts on a case-by-case basis with its staff. Does that sort of answer? I know that's a lot of information, might not be directly answering your question, but does that clear up a little bit?
I just feel like, Maren, this is not a case, for me anyway, the way I interpret it is not that an employee says, I didn't understand my contract. To me, this is where an employee is saying, Mandy, you changed the rules. You changed the rules. So Mandy, you're the one who didn't uphold this end of the contract, because I signed that contract thinking red is remote.
So
and now you're we're red and we're gonna stay in hybrid. So that's for me is my thinking.
Yeah, so I will say that the actual written contract that teachers sign at the beginning of the year is very basic. I mean, it's not, there's no attachment to it that says, you know, we will abide by this entire reopening packet. So technically the contracts that are in writing and the provisions in writing are very, I mean, I think it's a 2-page document. So,
no, I get it. I know the document. I know it well, but we've also, I don't think, ever had a reopening plan.
Yeah.
Ever. So I don't know that. So that's my concern, is where we have, I mean, which is probably more than you want to know, but just I'm thinking out loud. If we have 50% of our staff at some level saying like, no, I don't think we should be in hybrid when we're in red. And then we change the rules. So are we going to have half of those employees possibly coming into Gwen to say, this is an issue?
So I'm concerned because we're still in negotiations and we signed, we approved the same contract as last year so that they could come to work. So that contract last year didn't have anything to do with this plan because it didn't exist.
Right, but I want you guys to think about all the things, right? Because in all the meetings, parents have said, employees had a choice. They had a choice to not come to work in this district. They had a choice to teach online. They have these choices. They could take leave. And these employees that are coming every day made a choice. And I'm going to tell you that just from my experience, they were paying attention to this for sure.
So, and I understand there's people's perceptions and understanding of that, but this is clearly, the word said was contracts signed based on a plan. And I want to be extremely clear legally in black and white. If any teacher signed a contract with the attachment that said it would be to this red, orange, yellow, green plan. No. So there is no change to their work contract based upon, we are not out of contract with them because we did not attach this plan and sign these contracts based on a plan? Because those are the words I heard this evening.
Just our word and our integrity.
Okay, but we're still in negotiations, so everything is still up in the air on that. So we are not going back on anything written in negotiations under a contract, legally speaking, that was signed and agreed upon. And that's a huge difference. And I get, we have had all kinds of conversation all over the board about this being fluid, about there being changes, about different things happening. So that has been a lot of words, but legally, contractually signed, we do not have anything tied back to this plan.
So here's my question.
Yeah.
Half our teachers from our middle schools call Gwen tomorrow, a vote's made, and say, there's no way I can stay in hybrid, we're in red.
Yeah.
So what do we do then? What's the consequence of that to them? What's the consequence of that to us? How does that work?
And that's what I want to understand. That's why I'm like, I can't even vote on this tonight of a whole change to the plan or a one way or the other. That's why I like the status quo, which we needed that lead time of 14 days prior to change. This is the same thing to help us understand better info, to know what that is. And especially.
So, but then why do we need a change to the plan? Because then don't we stay status quo anyway? And we just need a committee that's gonna attach it, right? I mean, because I'm hearing a change to the plan.
Okay.
But I mean, maybe there's not. I mean.
And I think that's the conversation every month, right?
Right.
Is let's look at it, let's look at the new data, let's look at where we are, and let's decide, you know, do we think we need to change it or not? And we are presented with data this evening, and that's the question on the table. The motion is to stay where we are, get a committee and get some better understanding so that it can come before us again, and then we could decide, do we want to or not? Same argument we had last month, right? Do we change or do we not with what's in front of us? So very similar instances on that. And I'm just gonna say, in those similarities, guys, at some point we gotta lead. We gotta lead this district. We've gotta move forward, and we've gotta find some unification to where our parents and our teachers feel good about where we're going. And the constant, maybe not changing the plan, we've clearly got a divide. So I think we do have to change something and lead in some direction, is truly how I feel.
So I get that, and I respect that. I think though, I mean, some things I heard tonight, problems just with our plan right now. No athletics in red. We had 3 doctors. That's concerning, right? And we're there. And I think that was something we tried to do to bridge, right? I agree. We did, myself included. That was my motivation to change, right? We have this testing. If we have, or not testing, but surveillance testing. Am I saying it right? Whatever NMU is doing.
Yeah.
I can't remember the terminology, sorry.
It's okay.
But so, right, I mean, there's this give and take here, for sure. I agree. Something I heard, like at the hospital, they take precautions at very much higher levels than we do. It's more dangerous for teachers. That's what I heard. It's more risky at schools, were the exact words. We don't have N95 masks. I don't know if you've priced those. Like, I guarantee we can't afford N95 masks for our staff, let alone for our kids. It's not safe. We think that everybody keeps acting like our community's doing awesome in numbers. So check my math. We have 31 cases from November 1st to November 7th. I divided that by 7 because there's 7 days. And we're looking at the daily average rolling total. And I took our 1,335 staff plus our 13,300 students, which is 14,635. So I took 31 divided by 7, and then divided that by 14,635. And then I times by 100,000. That's 30.26 per 100,000. Our community, our kids are a part of this community. So even though we don't feel like our numbers are matching what our community and Canyon County's numbers are, they are matching. That puts our schools in orange. And we kept thinking like, our numbers are doing so awesome, like we're so great. But when we actually put pen to paper and do the math, we're sitting there. And we may be a week behind, which somebody, I think, said that. I don't remember, but I wrote it down. Darn it, and I didn't say who said it. But we're about a week behind on our tracing and our figuring out where things are. So that makes sense. We're in red. Our schools are in orange right now. I do think the things that we're doing are working. And it is frustrating. It is frustrating. I can tell you that this whole like physical distancing, it's really easy for us to put in a plan and say, yep, we're gonna physically distance. But are we actually walking into every classroom and seeing like, is it physically possible? Because I'm gonna tell you right now that it's not. Eric Main told us it's not. Not in all cases, not in all classes, with even half. I get it. And I think you're right. We do need to lead and we need to step up and lead and we got to do hard things. And this is a hard thing to tell parents, like, this is what's safe for your kids.
Well, and I was all with you.
Here's the deal.
Until you said, we have to tell parents. We cannot tell parents what isn't okay for their kids. They get to say that. They get that say, and they're clearly saying it. And hence the divide, right? And so, well, I'm never going to be a gatekeeper or I know more than you, and therefore I'm going to tell you.
I'm not, and that's not what I meant.
Okay,
that's not what I meant.
Tell me.
But right, I mean, they are going to say this is what you're telling us when this is what our schools are doing. So I get that. I'm not about to tell anybody anything.
And so there's the difference,
right? I'm not. Okay, I'm not a parent. But I will tell you, I've had thousands of kids. And I've interacted with those thousands of kids for 8 or more hours in a day, more than their parents interact with them on a daily basis. On a yearly basis, I've interacted with most of those thousands of kids, so I get it. But I'm not the parent. And tough love is a lot easier for me to do when I'm not the parent. I get it. And people are saying people die every day. You're right, they do. People die every single day. And it's not about living in fear. It's about living in the reality of where we are right now. Our staff are in this age range of people that are being hospitalized. And it is not for a short amount of time. Our staff's age range, they're camping out. Okay? And maybe some of them aren't. But some of them are, okay? We have to be responsible. This job is hard. Working in a school district, I don't care what job you do, it is hard on a normal year. I would put money on it, and I am not even a gambler or a bettor, but I would put money that the most unhealthiest group of human beings on the planet are educators and people that work in school districts, because on a normal year, their amount of stress is so stinking high. So stinking high. And now I'm going to tell you, it is not like times 10. It is like to the 10th power. It is exponential, the amount of stress. Because they know and they see each kid and they see how things could be better if we could just do this.
And I bet some of them are not even staying 6 feet away from those kids because they see that that kid needs to come and sit right next to them and work through things and do things. So the fact that these doctors are telling us, no, you have to be diligent. You have to enforce all of these things. Even tonight, I've seen it. People talk, kids talk, and they remove their mask. And I'm like, that's the absolute worst time that you can remove your mask. Breathing in and out and removing it would be so much better, but they remove it to talk because they want you to hear them. They want you to be clear. Guess what? It's not safe. Games, sports, I've seen it. I've seen our kids. They said, we're going to follow all these rules. We're going to do all this stuff. Well, guess what? They didn't follow all the rules. They didn't always have their masks on when they needed to. They weren't always in the smallest groups that they needed to. And yes, those are choices that they get to make, but it impacts all of us. On our board goal, it says, emphasize the future and the total community. And I get it. This has been sitting in front of me all night long. And I know it's a board decision. And so we're going to get to vote on this. But I vote there's no need for change. If we want to put a committee together to research it and dig deeper because we need more information, then I think we don't vote. We just stick with the original plan. To me, we set that plan in motion. We had help from our district health community. We had help from the CDC. We had help from doctors. We had help. We have help and support for our families and our kids. We have it if they need it, right?
May I speak, please? Amanda, again, I really appreciate what you said, and I think you make some very valid points. And I think there are a lot of people that need to hear exactly what you're saying. So I definitely appreciate that. But I'm going to come to you from a different perspective because we are different.
Yes.
And it's good to hear other perspectives. But what I heard tonight from the doctors is that we have been diligent and that we are being diligent, and that, as Allison pointed out, we are in the red. We probably have been in the red for a good week or two. And that things are going okay. Are they great? No, we're in a pandemic. They're not going to be perfect. But I think that we're doing okay. When I did the math, and I'm not a math teacher, man, so you probably will laugh at me, but of the staff, and I was looking at the numbers that came in Mr. Gesford's emails because that's what I had pulled up on my screen, but 0.007% of our staff have tested positive, and 0.0009% of our students have tested positive with the numbers that I use. And I'm happy to show you that. And I think that's incredible.
Yeah, that's nowhere even close.
You don't think so?
No.
Out of 21 positive tests out of 13,331 students?
You're talking this week.
I'm talking just this week. I'm sorry.
I mean,
overall.
it's 115.
Over the, yes, I
Yeah.
have that written down. I was just thinking this week, but that's a credit. That's a credit to the teachers. That's a credit to the school. That's a credit to what we've been doing. And I think that's awesome. I'm so proud of the Nampa School District. I'm so proud of how well things have gone and that, anyway, that we've done so well. And I think that there's just a lot more to take into consideration health-wise, as we've heard from other health professionals, medical health professionals. I think you talk about to the 10th degree for teachers. I think parents are feeling the same thing. I think I've heard, and this is just, what's the word where I want to say it's just a story. I have no proof. I don't know names, but I've heard there's kids who are having to sit in their dad's truck at a construction site all day because that's the only way they're going to get babysat. So they have no Wi-Fi. They have no way to do school. I've heard there are some kids at our school that have only ever shown up on the days when school is happening. So they've been to school 12 times this year. You know, these are just anecdotal. That's the word I'm looking for. So I have no proof. These are just people in the community saying, this is what I've heard. This is what I've heard. But I think that we have to, like Chairman Ross said, we have to somehow come together. You have over 70% of parents saying, when we're in hybrid, when we're in red, I still want my kids in the building. So we can't just throw that out. I don't think we can throw that out. These are taxpayers. These are the taxpayers who live in this community to send their kids to school in this community. And we're just going to ignore them and say, never mind, we know what's best for your kid. And I just agree with Trustee Westfall, there has to be some sort of a coming together. There has to be.
Here's the deal. I get it.
Yeah.
But our schools aren't functioning
I mean, we say that they are, but we don't have the substitutes.
We do, we have substitutes. It's running low, but we have substitutes.
Right, so do you know what happens when it's running low?
I guess you'll tell me. I don't.
People that have a job in this district, an important job, because I don't know one job in this district that's not important, are then asked to go cover.
Yeah, and that's the same in any other organization. That's what's happening all over the whole country, in every organization. My husband's a dentist. He can't just say, you know what, I just don't think it's safe. If that happens.
Do you know what?
We don't have any money. He has people's saliva in his face all day, and he goes to work and he wears.
I understand that.
We have to just continue.
We're pulling people though, who have an otherwise already job.
I know, and so is everyone else, everywhere.
Right, but some of these people by law have to service kids.
Yeah.
By law. And we may be in trouble if an audit's done, to be honest, and Paula might be like throwing daggers at me because she's like, why would you bring this up in an open meeting? But it is a concern. There are contractual things that have to happen in these buildings, and some of these people are being pulled because you're right, we can't leave kids in a room unsupervised.
So the reality is for lack of another term, we have a business to run, right? And we have parameters and laws in which we have to do it. Many businesses function that same way. COVID has thrown a wrench in that for everyone. Businesses have figured out how to modify, change, and function within those parameters with everything that has been thrown at them. So it hasn't been easy for anyone. And I thank the superintendent for answering that question for me, because that was the big issue that I've had, is I've been hearing from teachers at an enormous rate, and now seeing the town hall slides, I can understand why they're scared. And if I were looking at those numbers, I would be too. I would want them to know a different message. I would want them to know of the positives of the safety in our schools that I'm thankful that Trustee Westfall brought forward, of those recovery rates, of to help with what we have in our community. And I think it's in our community that we have to talk about. And this was a lot easier in the spring, because in the spring, everybody had a stay-at-home order. Nobody had a choice. Now, in our community, people are back to work. And so I've been asking the question, why are teachers different? What is different about what teachers are doing that are not causing them to join the community and be back? Because that's what parents are frustrated about, right? They're like, we're back. All our businesses are back. We're restaurant industry, medical industry. Everybody is making concessions. Every business owner is feeling the pain, to the same point of shutting down. No one has been discriminated, right? This virus does not discriminate to any of that. Everybody is feeling it. What we have to do, we have to figure out a way to run our business and make it work and move forward. And we need to educate kids, and we can't do our business just like anybody else without employees and without customers. We've got two, and we've got two that are clearly tipping the scales, and we have to figure out how to align them and get it to run and keep both happy, because we can't do one without the other.
But what I hear you saying is, yes, I agree with you that we need to do that. But in nowhere are we changing the things that we're doing, other than saying that when we're in red, we're going to remain in hybrid.
And maybe we need to, and that's why I'm saying I don't know, because I don't really understand why they're misaligned. And so I want to understand the why, so that I can figure out, maybe you're asking to be in person, but that's not the solution. If I understand your why, maybe I can come up with something else that gets you your end result, and also isn't in a direct opposition of staff and being in person. Maybe that's quality of education of how we're giving it or what we're doing. And they're saying, well, the in-person's working for those 2 days in hybrid, so more would be better, right? But I don't know that. And that's what I'm saying. I think we need to understand that better. So any further discussion? Should we go ahead and put that motion to a vote?
Is Allison still there?
I'm still here. Tammy asked me to type up my motion. I apologize. I was listening. I did omit, and I'm not going to amend my motion now, but Mandy, I heard you. I also heard that about sports, and I know we have the athletic plan later. That I agree. I heard that recommendation that we shouldn't be playing those close contact sports, but that's later on the agenda. But I regret that I didn't include it, but that's a lot. So yes, I'm ready to vote.
Okay. Trustees, all in favor? Aye.
Aye.
All opposed?
Aye.
Motion passes 3-1.
I look forward to hearing back from the superintendent and the committee about their recommendations on that red area and those 2 options and how they foresee that working.
Thank you. Thank you. You read my mind in my pause of trying to figure out how to address that, so I appreciate it. Okay, we will move to the next item of the athletic plan.
Chairman Ross, so there were versions of the meet. There was also in your packet just some basic corrections in the context of the reopening plan. I think we were hoping that you would look at that and tell us if we were okay with that. There were some clarifying statements. We had to make corrections on current guidance related to quarantine. We had to make corrections on definition of mask. We had to make other type of corrections. So we took the context away from all of that detail and gave you a suggestion in a red line edit. I'm wondering if you would consider changing that part of the plan. And then whichever version you eventually decide on would fit in the context of that other.
Superintendent, are those types of changes to our plan consistent across all 4 versions?
I believe they are. That was the intent, and it's why we separated it out from the versions.
So I would move that we would approve the superintendent's recommended changes to our reopening plan.
Second.
Okay, so it's been moved and seconded, but I'm confused. Specific to athletic.
No.
No, we're still back.
Athletics is in one of the 4 versions.
Okay.
So if you would like to pull one up and show those.
That would be helpful.
Which one do you want, Paula?
They're the same in all of them, so, right?
Right, so would you like to see the red line version or would the edits accepted?
Probably the red line.
Okay.
Hello, I'm Dr. John.
Do you want to review them page by page or what would be helpful for you?
Okay, so we're just talking about athletics at this point?
We're not talking about athletics.
Yeah, we're still on the reopening plan. So
Okay,
she's saying we punted and
There's a
did
part we
something
skipped.
totally different. But within the plan, there were things that were changed in that red line version. About masks and about different things to address. Yeah, grammatical changes, different wording.
Gotcha.
Yeah, the
Make
SIT
sure all of
partnership.
the references to an online resource were current. Based on the feedback from our doctors, use words like assess and monitor, just making it more accurate grammatically. We realigned the titles of the categories to match the state board titles so that we were there. And then there is a substantive addition which really follows with what we've done, for example, at South Middle, where if we're not able to provide staff, or if we can't bus, or if we have large, that we would consider closing individual sites until we were back up. So that would be, I guess, a substantial, not just an edit or correction.
So is that the most significant change to the plan, do you?
Yes, we, yeah, and then you can look at all of the comments, and I mean, it's completely redlined. We changed to make sure that our information related to NOVA was the same. And again, just aligned our practice with what's going on.
The one note change I noticed just toward the beginning is that we are mandatory face masks. And so that would be.
Yes, and that's a recommendation to bring clarity.
So not shields or not other things.
And
masks as well.
there is an asterisk that said, here are the instances in which a shield would be appropriate.
Awesome, thanks.
Did we have a second on my motion?
Yes.
Yes.
We did. I think my only major question, because I had brought it up in the last meeting to talk about close contacts with a negative test result. And so you went ahead and added that in the plan. Really, it was just added to say, even still, you're quarantined regardless. So we've kind of got every scenario under the sun that says whether you're positive, have a symptom, have been in close contact with someone, or someone identifies you as a close contact, that you are quarantined for that either, or isolated for either 10 or 14 days.
Each of those paragraphs aligns with the new information out from Southwest District Health, which has a flow chart. And so we've tried to verbalize what was happening in that flow chart.
Can you help me understand the process when someone is deemed a close contact? And I'll just put into context why I'm concerned and want to help understand this better. I guess to be blunt, I need to understand if this scenario is accurate. Somebody outside in the community becomes COVID positive. As part of their inquiry with Southwest District Health, they are to name folks that they feel that they have been in close contact with. Southwest District Health will then contact, say it's a minor, and in our schools, we'll contact that parent to let them know your son or daughter has been in close contact with someone who is COVID positive. As a follow-up, they are not able, when they make that call, to disclose who the people are or when and where and how that happened, or maybe they are to some extent because of HIPAA, and that's what I'm looking for some clarification and understanding on. And not in all instances, they can probably get a hold of folks. So as a secondary measure, Southwest District Health then works with our schools to let them know the names of those students that are a close contact. They're flagged in our system in the event that they come to the school, so that the nurse or someone can let them know that they need to be quarantined for their days and cannot be on our campus. Is that accurate?
So I'm going to let Anita answer that.
Okay.
That was very accurate for a community-based close contact, yes.
Okay. So my question and concern then becomes twofold. What recourse does a family have if that's a mistake? And how is that validated other than one person's word?
So I will say that in the community, the most common thing we see for close contact is family household close contact. And truly, with the exception of a few large party situations, that really has been what our close contacts in the community from Southwest District Health to us are folks who live in the same household. And then with some of them, it's a family member that maybe doesn't live in the household, but then of course has told the family they're close contacts. And they've had conversations with Southwest District Health in full awareness of who that person is because of that family structure, an uncle or an aunt or a grandparent that has spent time with the family. And then with those pieces, they go through and identify if anyone's exhibiting symptoms to find that close contact. With the exception of parties, that one is the only time that I've had it be where people want to disagree with the outcomes of those pieces. And that turns into such a he said, she said piece of it that that just is where sometimes they have to just say no more recourse or action to argue about that, because we have multiple people saying that close contact took place at this party with this person. And then it turns into everyone not wanting to quarantine. And that's the only time I've had that happen where there isn't that chance to kind of debate out the situation. Does that make sense?
It does for sure. And I think that's where I'm trying to get to is I'm like, how it seems that there's some opportunity, just as you mentioned in a party situation or a he said, she said, that I'm trying to look for ways to be accommodating to those folks so that we don't have an injustice. And that's where then I thought, well, does a negative test result help that? And how does that alleviate things, or a second verification? And also to really just looking for ways to be accommodating on that. And so I guess I'm looking for, I don't know, something within our own practices to maybe say that, I don't know, do we do a follow-up on that to help look into that?
I will say I don't want to become a community contact tracer. I don't work for Southwest District Health. I also don't want to be the lady making that final decision. I'm going to say that really passionately to you. We have enough work on contact tracing within our own classrooms. And I say that to you with a lot of passion. And what I would really encourage is, how about you not go to parties? And if you do, that you have the best protocols in place where everyone is masked and maintains their distance and uses hand sanitizer and isn't closer than 6 feet. And then we don't have to have this conversation. Yay!
I can appreciate that you don't want to be that person. I also understand the mind of teenagers. And I would really be bummed in a situation where someone was misinformed. And I think that would be unfortunate.
I think that's a great point to bring up with Southwest. I think Anita or Rebecca Burley, who is our nurse that's in charge of this, could explain. I think we're doing a great job when it's within our control and on our campuses. To begin to second guess what Southwest is doing in the community is probably a task that we're not able to take on.
I can appreciate that. And then my other kind of question is, I see our numbers here, and I've been trying to just kind of do the math and guesstimate about how many close contacts we have per positive, to know, is that number concerning or not? Do you have a guesstimate average per positive case that you're having to deal with of the number of close contacts associated with that?
Anita, before you answer that, I think a more accurate thing would be to tell you the range. A lot of times an average doesn't give you a really good idea of what we're dealing with. So I
guess I'm looking for the most probable number.
Again, we've had from 0 to, how many were you tracing today?
But that's not my question.
18.
So you had 18 positives that you were tracing through?
No.
I'm sorry, I thought your question was how many close contacts for one positive?
Okay, so your average is 18 close contacts per positive, roughly.
No.
That's what I'm asking.
And what we're saying is that if we give you an average, that doesn't give you a good picture. We have some.
And I think I'm okay
cases.
to ask the question that I would like to ask. No problem.
So Kim, I can tell you that maybe the average is 2. But in that, We have some zeros. No people have done really close protocols. And then we have an 18 that we're dealing with today where no protocols will follow. And 2 doesn't paint the picture.
May I ask a question, just for clarification for my own brain? If a student is at school, I've heard of scenarios where students are quarantining because someone that they sat behind in class tested positive. But I was under the impression, and I don't know, I'm genuinely asking this not knowing. If everyone is masked and 6 feet apart, then I guess my question is, why are people being quarantined because they sit behind that person in class? Is it because it's classrooms where masks are taken off, or classrooms where they can't stay 6 feet apart? Because I thought a close contact was within 6 feet for longer than 15 minutes. But I've heard scenarios where it's like, oh, this girl in front of me in algebra got it, so therefore I now am quarantined because she sat close to me. Is that not happening? Anita?
So in those situations when it's a close contact, it is less than 6 feet apart. So they're sitting in class less than 6 feet apart.
Okay, thank you.
Okay, any other questions, trustees? Should we go ahead for a vote? All in favor?
Aye.
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 You. All opposed? And I'm going to go ahead and abstain from that. Okay, so our next item is then the athletic plan. We had some initial discussion on this athletic plan. Do you have any recommendations for us?
The only plans that we had recommended exist in one of the versions, and we were trying to bring clarity to the colors and stage. So with this plan that we're talking about right here, we don't have any recommended changes. SIC superintendents meet tomorrow to consider a recommendation from SIC AD. So it might be that you would like to wrap some of the athletic information into the group of teachers and parents. I don't know. We don't have any recommendation for changes to this plan.
Superintendent, you recently were able to share with us an SIC for winter sports where they had come to an agreement. And some questions were asked whether we were okay to participate in that agreement that they had, that all of the districts had been able to come to. Do you have a report on where we are with that?
I think I have Mr. Carpenter online, and I think you're specifically referring to a delay in starting our winter athletics, basketball and wrestling. Is that correct? Is that what you're asking about?
I think the plan as a whole, and I think it's twofold for reason is, and this is where trustees, we might need to have some discussion and understanding, because I don't know how all of you replied to that email so that we didn't have any quorum or discussion on that. But this, my understanding is this came to us in the fall because the IHSAA and SIC did not come to an agreement and put it out to the different districts to vote themselves on their athletic plan, and hence we did. Now for the winter sports, the SIC has come to an agreement on how they would like to move forward. So I am not 100% clear if we have to vote on this item or if we're deciding whether to participate with the group or not. And if not, if there are any overlaps to our plan and their plan.
So that's a great question. As a member of the SIC, we get to abide by its bylaws. I'm learning this as we go as well. We've just tried to restructure the bylaws so that our ADs structure a recommendation, run it through the principals of the SIC, and then superintendents have the stamp that says, yes, let's do that. And so I believe that the board would not have to approve this. My attempt in communicating with you was to make sure that you were aware. Mr. Carpenter, I want you to listen well so you can correct me. We did agree to postpone the start of practice for 2 weeks, hoping that we would, hoping that in the length of our season that we would be able to finish it versus starting and then having cases. Currently, we're discussing fans, and this has a lot to do with the governor's guidance of stage 3 and either southwest or central of red. And so I believe there's a recommendation that has come from the ADs through the principals to the superintendents, and we do have a meeting scheduled tomorrow. So I don't know where that's going to be. Mr. Carpenter, would you add to that?
I certainly can. Obviously, we're dealing with the governor's stage 3 in Idaho, in his Idaho reopening plan, and we're also dealing with our district health. What we just found out is moving to level red. We did agree as a conference to postpone the start of winter sports. I'm sure everybody knows that the start dates are somewhat staggered. So our girls basketball was supposed to have started November 2nd. It will be backed up to November 16th. And then they put both boys sports, boys basketball and wrestling, to a start date of November 30th. All sports need 10 days of practices before you can start playing competitions or events. So within that, a stage 3 agreement was kind of along the lines of the governor's plan of allowing 50 fans for indoor sports and then 25% of your capacity for outdoor sports. I don't think we have to worry about outdoor sports for the winter. And then if we're in the red, we agreed as a conference that we would have no fans. And then if we're in the orange, we would allow those 50 fans. So then there's some discussion about what that would look like. I believe that kind of follows up with what you just said.
Thank you. So I'm feeling like they've come to an agreement and are still working through that, and that we do not need to have our own different plan other than where the SIC is.
Yeah. Sorry.
No, and I think that's my opinion, that we don't need to take action on that. Or go ahead, Allison, the trustee.
Yeah, you know, the superintendent is part of the SIC and her team. They've heard the same recommendations we've heard tonight about the dangers of having students play athletics. And they use this information to inform their decision making. So, and I'm sure they will.
Well, I thought we were required to have a plan.
So we are,
But
and if you
we-
noticed in what you just approved, we've added the line that we would work to abide with the guidelines of IHSA and the SIC conference, because that's what we're doing, and we're trying to abide by the bylaws of being a member of that conference. And so we added that line to reflect that. I don't think there's anything currently in either of the plans, the versions that we haven't yet considered, or in this plan that is counter to what you just heard. We've said no fans in the red. That's really consistent. And then we have, and for basketball and wrestling, we'll be able to accommodate this. I think we've said, depending on what we can have, either 2 or 4 tickets per participant, which is highly aligned with the 50 that the governor has recommended if we're still in stage 3, but in orange. So I don't see a conflict, and I don't think that we have to approve it. I think what we have presented is aligned and fits in with that.
And can you, or maybe Mr. Carpenter, tell me, like, have the ADs and the SIC and all those that are making decisions had doctor input like we had tonight, where they're being told in red, no close contact sports.
Mr. Carpenter, you want to comment on that?
I will try. I'm a little bit confused. I know that way back in April and May, when we were designing the guidelines and protocols for our summer plans, we consulted with folks from both district health, from the CDH and Southwest District Health, on kind of some of their guidelines on what we needed to do. We've just continued with the advice that they gave us. I think tonight, I'm certainly not going to argue with the professionals that spoke, but I'm not sure their opinions tonight would be included in our plan without having consulted with them further. I mean, after tonight, my head's kind of spinning, based on where we're at now. But our plan is pretty well. It's not. It's consistent with what our SIC ADs have put together. It's followed up by the SIC principals, and then it's also followed up by the superintendent. So it's fairly consistent across the board.
And that plan in the spring going into summer, though, said no in the red, I thought, for everything.
And remember that the plan in the spring going to the summer was wholly based on the governor's reopening plan, right? We talked about stage 1, 2, 3, and 4, had no colors associated with it because district health had not come up with those yet. Does that make sense? It's a little confusing.
Yes, okay, thank you. Yeah, all the stages and colors and yes.
So that's potential. Is that maybe then the only overlap, because the SIC's document only addresses the governor's stage 3, not the health district's red, orange, yellow?
So it does, and here's how they've worked to combine it. So we're currently on stage 3. Yesterday, Ada County was stage 3 in red. Canyon County was stage 3 in orange. If we would have been playing in Ada County, there would be no fans. If the game was hosted in Canyon County yesterday, there could be up to 50 fans. So they did combine them. They're saying, hey, stage 3 is going to limit us to this 50. And then the health district, red or orange, is going to direct whether or not we can have those fans.
So our current plan is in alignment?
I believe that it is, yes.
Thank you.
So let me get this straight. There may be a time where we're inviting fans from an area that may be at a worse level or phase or color than we are. Just because our color is one particular way, we're gonna allow fans.
Or it might be that all of the 50 fans are our fans in this area because we're in the orange and the visiting team is in red. So it gives us guidance
to do, okay.
And structure, and then and our folks have done a really nice job at saying what's going on over there and where are you at and here's where we're at, and our ADs have committed to making those phone calls to make sure that we're thoughtful as we move forward.
Excellent, thank you.
Mm-hmm. No, I'm positive that they're working together, and so I'm happy to move on. Trustees, anything else on this item? Okay, we'll go ahead and move to the community outreach discussion. Amanda, I'm going to let you take the lead.
Perfect. So yes, I did. Allison asked me if I forgot to put my name on my paper. And clearly I did. When you submit electronically, you don't have to put your name on your paper. That's US fault. But clearly I do. So I apologize for that, but this did come from me. And of course, this is all possible. I wasn't necessarily set on this. I'm not a huge language person anyway, so feel free to like tear it apart. but really just believing that in this district for several years now, we've really put a lot of pressure and importance on community outreach for our superintendent. And I felt like we needed, that could be part of our goal as well, and not just riding solely on our superintendent. So a few things that I thought might be possible ideas was just establishing and maintaining liaison with community groups. And I think part of us probably already do that, anyway, but we may just not know who those groups are and what those groups are. But especially those that are interested in, of course, our educational programs and building, obviously, our community that way and a symbiotic relationship, I guess is more what I'm thinking. But then obviously establishing and maintaining a liaison with other school districts, the State Department, possibly colleges and universities, and then possibly even so much to the U.S. Department of Education, because yes, that's how lofty my goals are, but I don't think that's going to happen overnight. But you guys can tell me, like, Mandy, you're crazy, like maybe this is what we can do, but just me, I'm global, I'm pie in the sky, like I'm going to reach for it all. And then just advocating for district, school, the school and students in our community, which I think we do that, but it also just talks to me about things, Kim, that you were saying about how we need more information and we need to bridge this divide, and we do that by interacting, right, and gaining more understanding and listening and moving forward in that direction. So I feel like it applies to especially the situation that we're in, but I think it's just beneficial in general. So I listed a few like possible maybe board goals around this, but looking at possible information to like possibly change the board's communication methods. For example, like in the survey that was presented to parents, like what's the best way you like to have communication? Like I thought that was a good one, and possibly even maybe something where we could get different communication methods and outreach kind of things. If some way works better than the other. Let's see. But especially that last line in that first bullet, like making sure that there are two-way forms of communication. I think sometimes, right, and it's really easy. I know none of the emails from last night or today did I have time to respond to. I read them all, but I didn't have time to respond to them today. But I wanted it to feel like there could be two-way communications, and what does that look like? Because obviously then the night before a board meeting and then day of, I don't know, some of us can respond, some of us, it may be depending on the day or whatever the case may be, but we may not be able to, but making sure that we think about those things so that we can communicate with our community members as well. And then just kind of looking and analyzing, like what community organizations do we already belong to? What ones do we think would be important to reach out and build relationships with that would be helpful? And possibly maybe even putting like a minimum requirement or something on things. So I gave an example of there will be representation of the board at a minimum of 3 different meetings or other community organizations. So kind of just thinking along those lines, and I wasn't stuck on 3 or whatever, of course, but I feel like we need to set a goal, one that we do think is attainable and reachable, but possibly something along those lines. And then of course, the last one is just working together to provide an opportunity for our stakeholders to communicate with trustees, possibly like a listening session. And I really want it to be a listening session, or like where I can listen. I know when I'm listening, like I want to be writing things down. I want to be taking it all in and having some time to process and make sure people can see and understand that we are listening. You know, it's hard when they send you an email to know, like, did someone actually even read it? Like, did they, Did they go through it? But, so I just gave an example of that, but it doesn't necessarily need to be that.
Discussion, trustees? I love it. And I think there's a lot of ways we can expand upon that, going to PTA meetings, going out to businesses and being available. I would love maybe some regularity to this in a manner that it could be out in front of us all the time, so that maybe we could get some assistance in activities or avenues. We used to get that on a monthly basis. I think, was it Kathleen or was it you, Tammy, that would put together, here's all the things happening in the district this month. It was Kathleen, right? And these are all the opportunities of things that are out there. And then us putting together, hey, I can hit that one or that one. Not only being available, but maybe we have some pertinent questions that we have. And if we have a question, then we can be purposeful going out to certain groups and listening and inquiring, saying, hey, I got a thought. Tell me what you think about that. And so I like that. I think it's great. I want to continue to develop this, but I like that it's us personally.
Yeah.
Maybe our next steps to kind of figure out the mechanism of which this gets in front of us on a consistent basis is maybe my thought. What do you guys think? Good.
Yeah, and I'm glad you pointed out that these were goals that we were setting for ourselves as trustees. I think I saw an email trying to query everybody's in the district's one, and I hope we didn't inadvertently create some work for folks, but things that we want to do to be more visible and to listen. These seem like reasonable things to do.
We do, and we all get busy and we can all put that out there. For the rest of this discussion, is there a manner in which anybody has a preference to getting this material or reviewing it? Whether it's an email, a calendar app, right? We could create a group calendar. I'm not sure. I'm just kind of spitballing some ideas.
Oh, where we could look and see what community meetings are happening when? Is that what you were thinking?
Okay. For the next steps of how we want to execute this program and the manner in which, yeah, we like the delivery to be, or the mode of communication or processes that we're going to utilize is really what I'm thinking.
I know one thing for me, and I don't know if this would be helpful or not, but like a board email that like sends to all of us. I know sometimes I'm like scrambling to look like, we do have that? Okay, I didn't know where it is or
board
what.
members.
Yeah, is that all it is? So if, and is that on the website? There's only certain things I really look at on the website, so I don't really know.
But it's in the Outlook. It's in Outlook. It's internal.
So you're talking about outside?
I was thinking both, and probably more so outside, just for community members to not have to like search
Every person
and add, because a lot of times I'm like looking and I'm like, okay, did everybody get this? But just kind of even thinking of streamlining that email process. I don't know if that's doable or not, or if it's like, shouldn't even be on the list of things to do right now. And I get that if that's the case, but just that, you know, that wondering of like, oh, did they send it to everybody? Did Tammy get it so that it can go in the board document or what, you know, whatever needs to happen. I don't know.
Mr. Chairs, I'm thinking that we can create an email that is public facing that can go to all 5 boxes. Is that correct?
Mm-hmm.
We can do that.
Yeah, nice delivery. I'll look into some apps that maybe we can all utilize
I did like the group calendar or like,
Yeah.
yeah,
Okay.
thing, because then we could each put things just to
Shared
even
calendar,
and kind of share that way of like, you know, Betsy can say this is where I'm gonna be this week or
Yeah.
whatever.
And then we know if there's a quorum and you
And
can
let,
always see that as well.
So do you
Because
want us to help you with that, or is that something you want to pursue?
we're happy to have help, always. Yeah, any advice on that as we get together, we should absolutely include our board clerk in whatever this is that we
Right,
do. And make sure that whatever we're doing, we're mindful to note that we plan on being there and at least have it be 24 hours in advance.
Yeah, I don't know that a calendar I would notice that you guys would all be, you know what I mean?
Yeah.
I don't know.
but or then if we could notice,
I'll talk with Tech though and see what kind of tools we might have.
yeah, because even if we could notice and go, then shoot you a message, hey Tammy.
Yeah.
The three of us are gonna be there on this, you know, next week on this day.
Thank you.
Yeah.
That'd be awesome, super helpful.
I thought maybe Allison was gonna say something.
It's 10 o'clock, we're getting to that time.
This week, sometime this week.
All right, let's go ahead and move on to the monthly budget status report because Randy's asleep.
He's not, I just texted him.
I'm not asleep. It's a riveting conversation.
Mr. Dooley and his team have again prepared reports and they're happy to stand for questions.
I have a question on this report, and I think as I perused it and I perused all the different accounts, I could see the percentages spent and where we're at. It all appears to align with standard protocols and where we should be for the year. Probably my bigger question and concern is next month, can you give us where we are spending our CARES Act monies? And I hesitate to ask, do we need an updated budget as well? So I'll leave that to discussion. But that's the thought in my head that I'm thinking might be helpful to know and understand.
So the plan is the exact same. We've been following the exact same plan that we presented last month. But we can, I can work with Dr. Keller and get you an updated actual at that point in time and see exactly where we are. By the end of December, remember the coronavirus relief fund has to be spent 100%. That's $4.4 million. So we're working diligently to make sure that all those expenses are spent. And then moving over to the ESSER funds, which is the other $3.3 million that we got. So we can get you an updated budget for that for sure.
Thank you.
Randy, how did the extra pay that's coming out in November, how did that work in the budget without an approved agreement with the association or with the board?
So we don't and this is my belief, this is federal funds. It has nothing to do with a negotiated agreement. This was for all employees. This was money that we decided to do through the federal funds, and federal funds are not negotiated through a master contract.
So we will have to do some sort of budget thing since it wasn't anticipated and shown.
Yeah, so that entire $4.4 million at the end of the year, normally we don't, as a district, I've always had a hard time at the end of the year, basically coming and saying, here's last year's budget and all the corrections and approve that one. And then here's our new budget. We've never done that since I've been here, but this is the first year we'll need to do that. That was what was recommended by the state finance to do. And that's what we plan on doing, is providing you guys with an amended budget at the end of the year. And then and along with a new budget for the next year.
Okay, thank you.
Mm-hmm.
I just wanted to clarify, the money that was spent for that was in the CARES Act budget. It was bounced in on money. So it is in the money that we were planning to spend by December. In that number, it was labeled stipends or extra pay or hazard pay. And so when we report, we'll show you where that is. And I just need to clarify, do you want us, so I think what Mr. Dewey just asked or said is that we can do the amending of the budget at the end of the year, or are you asking for us, there is a process to do it now or in the middle of the year? What are you asking?
Oh, I was just curious how, because the board approves the budget and then they approve pay for our certified staff in the master agreement, and how that was done without it coming before the board without an approved agreement. I think I heard Mr. Dewey say it's federal funds, and that it would be okay to show that as an amended item later in the school year.
Which is what most other districts are doing as well. Most other districts have opened up negotiations because they were trying to do some other things with their master contracts, but then they've closed them back up again. But these federal funds are not negotiated. Therefore, we make the rules on those ones. I would recommend that we not try to do an amended general fund budget yet until at least January, February, until we know what the state is going to do with the potential movement to fractional based enrollment versus ADA. That is one that we won't know until the legislators approve the state boards change to the definition of ADA.
Yeah, and I don't think I said do it now. I was just asking, how that works in terms of authority. It wasn't in the budget approved by the trustees. No negotiated agreement came forward to the board. So, how does that work? It sounds like you believe that discretion exists.
Yeah, that was what was recommended by the state finance, because I'd actually asked if we needed to amend our budget right now, right away, to be able to spend any of this coronavirus relief funds. This is, remember, $1.6 million or so of that $4.4 million of the entire amount that needed to be spent before December 30. And they, state finance, Julie Oberly, basically said in the main meeting that she recommended us doing what pretty much every other district does around, is do the budget amendment at the end of the year.
Trustee Westfall, I also just want to remind the board that we did bring this plan on how we were going to spend the 4.4 million in front of the board. You are correct. The board did not take action on it, but the board was able to see the plan and what our intent was in order to use that money.
What was that total amount that we're discussing?
So the new money, the 5%.
The 2.5. What did the 2.5 come to in dollars?
Oh, 1.6. Thank you.
About 1.65 is what the final calculation ended up being. Almost 1.7. Actually, we have a couple other people we have missed on our original calculation that we're running another adjustment tomorrow.
Thank you. Any other questions? Anything else we should know?
We'll just hope those legislators approve the fractional enrollment. So whatever you guys can do and tell them that how important that is, that's truly very, very important for us, guys.
All right.
Thank you, Randy.
Thank you. Moving on to policy review.
All right, looks like we have the certificated employee evaluation policy up for second read, 5340. The amendments are there, and then we did add, as a result of comments in the last board meeting, a line on the last page, which reminds us that committee membership will be reported to the Board of Trustees.
Did these go to the policy committee?
These have a committee of their own set in code.
Okay.
And yes, both Allison and Mandy.
Before last month, this is the second.
This is
Yeah,
the
this is the
read.
second read, so yeah,
yes.
we saw it,
You did.
yeah,
Okay.
yeah. Before
Okay.
the previous month even.
Thank you.
I'd be open for a motion.
I move we approve policy 5340 for second and final read.
I'll second. Any discussion? All in favor?
Aye.
Aye.
Aye. We've lost Allison.
I was on mute, sorry. No wonder you didn't.
I did call a motion to vote and all in favor. I didn't know where you were at.
Aye.
Okay, all opposed? None. That motion passes unanimously.
The next action are two policies out of curriculum 2100 and 2150 that are ready for second read. Just want you to note policy 2540. Trustee Westfall, I believe, asked us to include the words about adding committee membership when we do curricular materials. We felt like it was more appropriate in policy 2540 where it actually talks about the committee itself. So we're suggesting we approve these two as is for second and final read, and then address 2540 as a revision for first read.
So no change to 2100.
Well,
In that,
other than
what we saw from the
was
first
already
read, yeah.
left.
Okay. Yeah. And same with 2150.
Correct.
Motion?
I move we approve for second reading, policy 2100 and policy 2150.
I'll second. Any further questions or comments? All right, all in favor?
Aye.
All opposed? None. That motion passes unanimously. Next
And then
item.
2540 reflects the line regarding committee membership being reported to the board. So this would be a first read.
And thank you for adding the procedures with that for us as well. It's appreciated.
I move we approve for first reading, policy 2540.
Second.
Any discussion? All in favor?
Aye.
Opposed? None. Motion passes unanimously.
Yes, and Steve should be on.
The next policy is our graduation requirement policy. If you remember, at the end of last year, we suspended components of it based on the state board recommendation. The state board has suspended the senior project requirement. Many of our seniors have already participated in a written requirement, and we actually think that it incorporates itself well into senior English. And so we would like to continue that, but we would love for you to suspend the oral presentation. Mr. LeBou has met with our 3 high school principals, and that would be their recommendation to the board.
Through the end of December.
Through the end of next December, which would include our summer graduates and first semester graduates.
And that's just on line, that
It is
very end of the document, I think, that very
correct,
last
on
line.
line 39 on the second page.
So we
I
want
didn't
to,
get to tell you what things I wanted to add to this.
I was going to say, I mean, obviously, when the graduation requirements committee comes back in the event that we have any recommendations, we'll bring this back at that time. We won't have anything that will affect this year.
Yeah.
So
I'm just messing.
I know. I figured I'd say it too, though, just in case.
I move that we. So
you're really suspending the oral
Yeah, we're
presentation
not
of the senior.
approving for first read. Okay,
No.
thank you. So I move that we suspend the oral requirement on line 39 of the last page for the senior project through December 2021.
2021, yeah.
2021.
Yep.
Thank you.
I'll second.
It's been moved and seconded. Any further discussion?
Our seniors are gonna be happy.
Well, I kind of have an odd question though. When we do December of 2021, does that, do we know our calendar where we could have anybody graduating early next year as that fall semester?
And if they did, they would fall under this requirement.
They would, and
did
you're
graduate early.
requesting that this incorporate up to summer. So I'm wondering if we should have a date of an August instead of a December, because I do hope to have some graduation requirement committee updates that I could bring in the sooner that could affect the next year.
To your discretion.
And so what would be the date that you would need for this year and this summer of graduating seniors?
We have seniors that graduate through the summer. We have seniors that graduate that post their graduation in August and September. And so you just need to decide a cutoff. Our intent is that if they currently are in their senior year, that we would suspend this requirement. So maybe you want to say something about the class of 2021, that we suspend this oral requirement for the class of 2021.
Yeah.
Okay, so just change it to suspend.
So you could vote this motion down, which has been seconded, and then create a second.
Yeah,
motion.
that was the discussion, so.
Okay, so all in favor?
Aye, or no. No, I was in favor of voting it down. Sorry, it's late.
All opposed?
Aye.
Motion fails.
Okay, I move that we postpone the oral presentation of the graduation requirement for the senior project on line 39 of the last page for seniors in the class of 2021.
I'll second. That's been moved and seconded. All in favor?
Aye.
Aye. All opposed? And that motion passes. Thank you for the help with that flexibility.
Yes.
The next policy, 3085, is ready for a second read. It has gone through our system. We have attached the procedure that is with it, which has not been edited or reviewed by a complete administrative team.
For motion, I move we approve for second reading policy 3085.
Second.
Any discussion? No? Okay, all in favor?
Aye.
Aye.
All opposed? And that motion passes unanimously as well. Next item is District Policy 1300.
Madam Chair, if you don't mind, I asked that we put this on there. You know, we set up this policy committee with two trustees. Trustee Simpson served on it, and Heather Lewis served on it as well. And I'm not sure that we ever created a structure or a process, and whether we need to do that. And Mandy and I didn't get a chance to connect to talk about it. We don't function as a committee. What happens is, you know, we get, you know, maybe an email, we'll get an email from Tammy on some of the policies, not all, and that's not a criticism, but we heard tonight, you know, this committee looks at this policy, and just what do we want to continue to ask two trustees to do this? What would we like them to do? And so it was a discussion item, but this is our policy on how we create policies, and we don't have our committee mentioned Mandy, you want to weigh in?
Yeah, I mean, I also think, I think hopefully what you see is, I just feel like we need to take a little more ownership, and I feel like, these are board policies, and yes, we do very much need district leadership support and help in seeing how do these things work, and then you writing them so that we know what's the intent behind them, and then how do things work and how does it play down to their procedures, right? And so kind of just thinking of, I say this, but honestly, just have more of a role, and then also a piece of what happens if, kind of just making it clear, if one of the trustees wants a policy to be reviewed, what is that procedure for us? I felt like this was a good place for that, of just kind of that, so not district procedure or anything, but what's our procedure in this piece of things? And what does that look like? I don't know.
I'm wondering if ISBA has any procedures that accompany this policy.
It's also possible that it was a more robust policy before we adopted it.
Oh, right, and it got, yeah, okay.
So
That makes sense.
we can look at both of those and bring that to look at either an original one or to look to see if there are procedures.
Yeah, and perhaps this could be a task for the policy committee to work with our clerk and see what the original policy looked like, and have her reach out and see if there were procedures.
And would you also be interested in referencing a board policy committee on this, or is that why you're referencing procedure?
Yes.
Right.
Yes and yes.
Okay.
It's possible there's administrative procedures, but there's also possibilities of having a board procedure, that describes it, that isn't in the policy, that we would approve.
And then just grammatically on line 2 in line 1, the very end of that line, on line 1, I think it should be the superintendent shall have the power to act instead of to power to act. I know, when I blame my dad. I blame my dad. I like it.
In the interest of time, does that sound reasonable to the other trustees, that maybe Mandy and I work with the clerk?
Absolutely. Yes. I was going to ask if you wanted to do this on the site, or if you wanted to do this as part of our workshop with board norms, which would be a preference.
I think we need a draft instead of creating from scratch as a team, maybe a draft to work with.
I feel good about our current committee members for the board policy to work on this together and to bring something back to the board.
Mandy, you feel okay?
Yeah, definitely. Thank you.
So any action or motion for this?
Nope, just wanted the conversation, and I thank you. I think we have a draft.
Can we approve it for a first read though? Or do we not need to? Okay, perfect. Yeah. Okay.
All right, and let's head to that last action item of dual enrollment.
The trustees asked us to be placed on the agenda as well. We did have a patron who came to talk with us about our current dual enrollment procedures, but trustees asked to review the policy, which we have before you, and then we have shared with you how we've adjusted the procedures based on the situation. We have would suggest that we would work with our homeschool folks who are not enrolled in another public school that's receiving money from the state, and then they wouldn't be charged fees. We've already communicated with the 7 students that impacts this year, that their fees have been waived. So we've, I think, resolved that situation. We do believe that if a student is enrolled in a public school though, and that school is receiving money from the state, that we would share the burden of the expenses. Hopefully with the school who's receiving the money, that is where most of our fees are associated with our students are coming from, and we feel it's fair that the other public school would participate in the burden of the cost of providing extracurricular activities. So we're not recommending a change to the policy at this point. You can discuss, and if you would prefer changes, we'd be happy to listen. And you don't need approval on the procedure. We're just showing you how we have remedied the situation.
I guess my line of thought was that there really is a cost that we bear to run our athletic program. And so I don't know that I felt that it was accurate that there was no additional expense that we incur by adding those folks in. Maybe not on that individual basis, being that we already had a coach and we already had a team and it was one more person. And so maybe for that one-off, that was an accurate statement. But I think as a whole, for a policy and a procedure, to have an open-ended statement that says, you know, because it looks like we've changed, right? That now any homeschool that's not enrolled in our schools can come in, participate, and no fee is assessed, makes me concerned for, I don't know what requests they're going to ask of us to join, or how many that becomes. And to say that the use of our facilities and how we equip them and have a coach, I feel like we're kind of opening up an area where we are bearing quite a bit of a financial burden to do a team that we may not have otherwise had at a school due to this request that's going to be unknown, we're not able to prepare and plan for. And I really do kind of feel like there is a cost associated on the whole scale. So I don't know. I appreciate that we were accommodating this year to those folks. But I think moving forward as a policy, I think we're opening ourselves up.
So am I hearing you right where you think maybe like a homeschool student and parent may say, we want to have shuffleboarding as a sport, and so we're going to hire a coach and then fill that? Is that what I'm hearing, or no? Because I feel like that we already have those things in place where those aren't just going to happen. And yes, we're going to pay a coach for that. Does that make sense? So I feel like all of these things that the students would participate in are already.
They're already there.
They're already there, and there's already a coach. And
let's say that there's 42 kids on the cross-country team, and then we have 4 homeschool kids join, which requires a second bus. And then now we've paid for a second bus, and I don't know numbers, I'm totally making things up. But these homeschool kids come, they haven't paid anything, but we're required to transport the team. And so now we hire a second bus, and our, the money that we get helps pay for the bus for these kids. Anyway, that's an example I'm just coming up with. I just wonder if it'd be easier, as the superintendent pointed out, this isn't a high number of people. This isn't a lot of people this impacts. But I wonder if it would be easier to just say, this is going to be seen on a case-by-case basis, or we would work with the homeschool family instead of saying it's free, or is that too much?
Well, I'm concerned about unintentionally discriminating, or somebody perceiving it as discriminating. So yes, you're Betsy's son, so we're going to work with you. Andy, we're not sure. So I would be concerned about that.
And so maybe we need to go back and re-understand why was the fee assessed previously that we waived?
So this brings our policy in line more with West Ada and Boise and Middleton. The district for many years, since maybe 2006 or 7, has had a policy, particularly when the charter schools in the areas did not have athletic teams. And most of the time now they do have athletic teams. So it isn't as common, but if a student wasn't able to play basketball at a local charter, law says they have to participate at their home school. That charter received money from the state for that student. We receive money for every student who's in attendance, and from that money, we're paying for extracurricular activities. Just a reminder, our supplemental coaching salaries, our supplemental salaries are somewhere in the $1.1 million. So it was originally instituted to work with that local charter school to share the cost of providing that program. And I honestly don't remember at the beginning of time whether homeschooled students or private school students were included in this. Yes, they were. The difference is that private school students and homeschool students are not enrolled and do not receive any state funding. And so there is no profit or money sharing to be done because there is no state money. They are our students, they live within our attendance boundaries. So that's, I guess, the background that I have to offer to you.
So would this now include where maybe it did before, but I'm noticing the or enrollment of a LEA, right? So our now pathways in Idaho Arts Charter was that like an agreement we had with them prior? I mean, I know Idaho Arts Charter has some extracurricular things that they do as well, but I don't know that they have as much.
Yeah, they don't have as much, but if they, for example, don't have a basketball team and they were students that live within our attendance, then that student would have to participate at their home school.
Okay.
And so, yes, then we would share the responsibility of paying.
Okay.
They would help in that.
Okay.
So help me understand what where Schedule B is utilized. Maybe I'm not understanding this properly.
So Schedule B
Okay.
now would be utilized for any student that was not enrolled in a public school. That was enrolled in a public school. So right now it would be, yes, so IAX, a student wants to come and play on the football team. We'd have an agreement with IAX, they would help us share the costs of that student participating on a football team. But if it was a homeschool student, not enrolled anywhere, and no school or district is receiving money for them, then they would not, there is no money for that parent or school to share with us.
Gotcha.
Okay. Are you feeling like it just seems a little generous?
Well, it's two schools of thought, right? There's a reimbursement conversation that says, hey, charter, you've taken on this student and this feels like a reimbursement in a way, from school to school, right? Where that child and that family, they're not coming up of anything out of pocket.
So some charter schools will not sign an agreement with us, and there are times when the family does pay that out of pocket.
Okay, that's helpful to understand as well. So, and that's really right where I'm trying to get to the crux of it.
Our first hope is to work with the charter school who's receiving money for the student.
Okay. And so these are all choices that parents make. Parents make a choice because they're living in our district. And so if they want to play a sport, they have to do that within their home school. Now, if they choose to do a charter, then we have Schedule B, where we can decide to work with that charter, but that parent's making that choice to go there work with that and decide for themselves, and then can then make a choice to say, I choose to have my child do a sport here with the Nampa School District, and there's a cost associated. We're changing in this based upon, we heard a grievance and we heard a concern of a homeschool that didn't feel, and I need to readdress some of those reasons and explanations why, but that's what this is. It says, why am I being assessed a fee? And so that's being waived now for homeschoolers. So that's people's personal choices, that's reimbursement or not. But I think for us, at the end of the day, we have to say, do we have a cost to run these programs? And I think that answer is yes, in my mind. And so you're choosing to homeschool, but now you're choosing to participate in a program that has a cost associated to it. I don't know why we wouldn't ask for some monies for that. I think is where what I'm thinking. Random thoughts. Okay.
I agree with you, but I don't have a really great solution to bring to the table, but I agree that these things do cost money, and it seems very kind and generous that we would do that. And so I don't think it's necessarily a bad thing, but if it is costing us, then I don't think that it's a problem to ask for a little bit. And maybe we cut this in half for a homeschool, you know, I like to see kids participate and I think it's great, but I do think that these things do cost us money, and with busing or with uniforms or with other things that
we do utilize and do. And so I don't think there's any change to policy. And this is a procedural item. I think we were looking, we never really had an opportunity to address the concern. We're thankful that the district was able to absolve that for us. We're kind of given this opportunity to put on here and to see policy-wise if we had any other thoughts. And I think policy-wise, sounds like we're all in accord that still holds firm. Yeah, it's the procedure part that's a different conversation, and we will leave that to the discretion of the administration. Perfect. All right, legal update.
Nothing from me tonight. I will see you all in executive session.
Excellent. Superintendent comments.
I have no additional comments. Thank you.
Trustees, Trustee Westfall?
Oh, no additional comments in light of the time.
Trustee Simpson, same. Trustee Keller, and same for me. Board self-assessment.
Yeah. Tammy asked me to do it because it was Mike's turn and he wasn't here, but it's okay. I think it was my turn anyway. So I thought we did a pretty good job. Some things I think we need to work on, especially where I know we're passionate and I'm passionate, and I checked myself a couple times or tried to check myself a couple times. But I did say that we need improvement on a couple things of board members were prepared for the meeting there were a few things that I feel like a few of us got hung up on a couple different things. So nothing like super major where I felt like it was like, did we see that? Did we read through it? Did we know what that was? And as a group. And then the other one was the board's treatment of all persons was courteous, dignified, and fair. There was a respectful atmosphere. I know we respect each other and I respect each and every one of you, but I know there were times for me this evening that I feel like I needed to be checked and stopped and breathe for a second and not be so passionate. And so I thank you guys for your kindness and your care and being patient with me. But I did mark that for those reasons as two things to work on. Thank you, Mandy. Thanks.
Thanks, Mandy.
All All right, upcoming meetings. We did decide to do a work session next week, next Tuesday. Our board clerk was kind enough to check in and say, where's all your documents? Today's the day, a week before. But really, I think it's a work session. It's a work in progress for us to go over board norms, to work on them together. So we don't have anything formal that you need to review before that, other than just your brains, right? And we'll be able to talk through as a group some ideas on board norms.
And we did specify 90 minutes for that meeting.
We did. Yes, thank you. And then our next, regular meeting, December 10th. I think in some of our conversation earlier, we said December 8th.
We did.
December 8th. It is the 8th.
It is the 8th?
Mm-hmm. It's the 8th.
So we might need to just, change this on, I don't know if you want to change it here on the agenda, or we're okay. All right.
Is it not right?
No, it's wrong in board docs.
Madam Chair, I think we had discussed, is it Thursday, making sure there was a trustee who could vote for us at the ISBA business session?
I thought that you and Trustee Keller were going to be here on Thursday.
Right, I just wanted to make sure we connected on that. And do you have our secret login code, Tammy?
I have the document from ISBA over on my desk.
So yes?
Yes.
And do we as trustees then need to coordinate with you for individual votes on that?
You know, we had a conversation at our last meeting. I think it was our last meeting about the resolutions. I'm comfortable voting.
I missed that. Help me maybe you can bring me up to speed on what I need to do.
Yeah, are you gonna join the meeting, Kim?
Yes.
Okay, yeah, then.
So I'll just vote on my own for that, or do I need to come here, or I need to be here? Okay.
Yeah.
Anyone else planning on being here that we need to be here? And Betsy will be here as well, so we will have a quorum.
Yes.
Thank you for that. Okay. All right. We do have need for executive session this evening.
Be it resolved that the Board of Trustees of Nampa School District number 1 through 1 recess from a public meeting into executive session in the manner and for the purpose authorized by section 74-206 Idaho Code to discuss matters pertinent to this district, specifically subsection B, to consider the evaluation, dismissal, or disciplining of, or to hear complaints or charges brought against a public officer, employee, staff member, or individual agent or public school student, and J, to consider labor contract matters authorized under section 74-206A, 1A, and B Idaho Code.
Second.
So moved and seconded. Roll call.
Trustee Simpson?
Aye.
Trustee Westfall?
Aye.
Trustee Keller?
Aye.
Chairman Ross?
Aye.
Just as a point of clarification, we'll leave this at the Board of Trustees so people know where we are, and then we'll convene to the West Room and we'll join another Zoom. I'm assuming that Trustee Westfall has the access.
Yep.
I do.
Yep.
In order to convene over there.
You're on.
All right, we officially adjourn. Thank you.
Thank you.
Good night, Kim.
Good night, Kim.
Well, Kim and Kim. Everyone.
Yeah.
Color Street.
What's that?
I'm